Good morning. My name is James Valentine and welcome to the externally led patient-focused drug development for X-linked retinitis pigmentosa. I'm here with my co-host Todd Durham from the Foundation Fighting Blindness, and we're coming to you live from the Washington, D.C. metropolitan area, actually not too far from where the Food and Drug Administration's headquarters are located. It's my pleasure to introduce and welcome Todd, the Senior Vice President of Clinical and Outcomes Research from the Foundation, to provide an opening to today's meeting. Todd?
Thank you, James. Welcome, everyone, to the externally led patient-focused drug development meeting on XLRP. The mission of the Foundation Fighting Blindness is to fund and drive the research that will lead to preventions, treatments, and vision restoration for the degenerative retinal diseases, including X-linked retinitis pigmentosa, or XLRP. In my role at the Foundation, I am in contact with people affected by XLRP every day, and I manage the Foundation's registry, which has several hundred individuals affected by XLRP in the U.S. and worldwide. XLRP is a progressive, degenerative genetic disease caused by mutations in the RPGR gene and, less commonly, in the RP2 gene. As you will hear and see today, many living with XLRP are severely affected, and some have completely lost their sight. For those listening and learning today, I ask that you thoughtfully consider these stories and imagine what life is like with XLRP and what a treatment might do to improve their lives. We hope and expect this meeting will encourage future research and successful new product development for people living with XLRP who urgently need safe and efficacious treatment options. Thank you to the U.S. Food and Drug Administration for giving us permission to hold this meeting and for attending. We are incredibly grateful for this opportunity to share this community's experiences with you. Thank you also to our generous supporters who financially sponsored this meeting, including AGTC and Biogen. We are really pleased to have in attendance representatives from advocacy and professional organizations, drug companies, federal agencies, and universities from across the world. And to the people with XLRP and your loved ones participating, this meeting is for you. We invite you to call or write in during the program and ask that you participate in the remote polling as well. We want to hear as many perspectives as possible. Understand that we will do our best to get to all of your comments. Please only use your first name and no other identifying information should be shared. Let's get started. To begin today's meeting, I am thrilled to introduce Dr. Katerini Silu. Dr. Silu is a medical officer in the Office of Tissues and Advanced Therapies in the Center for Biologics Evaluation and Research, or CBER, at the FDA. We are very fortunate to have Dr. Silu with us for this specific meeting since she is a board-certified ophthalmologist and an ophthalmic geneticist. Dr. Silu will provide some opening comments from the FDA perspective. Dr. Silu?
Thank you for the introductions. Good morning, and thank you all for participating. I am Dr. Ekaterini Tsilu, and I'm an ophthalmologist, an eye doctor. And actually, I'm a trained ophthalmic geneticist, and I have examined and followed several patients with retinitis pigmentosa and X-linked retinitis pigmentosa in my clinical practice. I'm currently a clinical reviewer in the Division of Clinical Evaluation and Pharmacology Toxicology in the Office of Tissues and Advanced Therapies. Our division reviews drugs for a wide variety of ophthalmic diseases, including X-linked retinitis pigmentosa. We're very happy to know that so many of you are here today, patients, caregivers, participating in the audience and on the web of this meeting on patient-focused drug development for X-linked retinitis pigmentosa. I want to thank each and every one of you personally for your participation. I know we also have representation from the academia, the industry, and other medical product development stakeholders in the room and on the web. I cannot tell you how much myself and my colleagues value the opportunity to participate in these meetings and to hear firsthand how you and your loved ones experience this disease and help us understand your everyday problems and incorporate that in the drug development process. We are really looking forward to incorporating what we learned today in our daily work. As you all know, X-linked retinitis pigmentosa is one of the most severe forms of retinitis pigmentosa and a visually devastating disease that starts early on during the first 10 or 20 years of life, leading to the generation of the most important cells in the back of the eye, the photoreceptors, we call them in medicine, the rods and cones. Rods are the cells responsible for vision in the dark, and they degenerate first. So symptoms start with night vision problems, but progressively expand to affect your peripheral vision, your side vision, your day vision, and your color vision. Unfortunately, we don't have any effective treatments for this disease yet, and we cannot not only reverse, but we cannot stop the damage done to these photoreceptor cells. We fully understand that X-linked RP is a serious condition, and there is a vast unmet medical need for patients with this disease. Therefore, having this kind of dialogue with you is extremely important. What we want to hear from you today is the different ways your symptoms and your experiences affect your daily life. It's also important to hear what you value in a treatment for X-linked retinitis pigmentosa and what would you like to see in a future treatment for you. This information will help us create the most appropriate treatments for your disease. But we have to know that we, the FDA, are not the ones creating the medicines. We don't independently conduct clinical trials, yet it's our responsibility to promote the public health and ensure that the benefits of a drug outweigh its risks. So we work very closely with the drug companies throughout the whole drug development process, starting from the beginning when they're just discovering new molecules, then when they apply them and they expose them to animals, all the way up until they are ready to submit their marketing application and all the trials that happen in between. And if a drug gets into the market, we continue to work carefully with them to conduct surveillance on these drugs as well and ensure that we have accurately described both the risks and the benefits of these drugs as additional scientific information becomes available. I know there are a lot of representatives of industry, academia, and others in the room and on the web as well. We look forward to incorporating what we learned today in the agency's thinking and understanding of how patients view benefits and risks of therapies and devices for X-linked retinitis pigmentosa. Once again, we're here today to hear the voice of the patient, your voice. So thank you for participating. We're grateful to each of you for being here and sharing your personal stories, experiences, and perspectives. And now back to the studio. Thank you.
Thank you, Dr. Silu. And now I would like to introduce Dr. Tharan Jayasundara, who will be presenting a clinical overview of XLRP to help create a scientific foundation for the rest of today's meeting. Dr. Jayasundara is Professor of Ophthalmic Genetics, Associate Chair, Strategic Implementation at the Kellogg Eye Center, University of Michigan. Welcome, Dr. Jayasundara.
Good morning. Thank you very much for this opportunity to speak to you. As mentioned before, I'm from the Kellogg Eye Center, and we have a wonderful program in retinal dystrophies. And I see patients with inherited retinal diseases, and I also have a research program in clinical outcomes for patients with these conditions. These are my financial disclosures. There are many inherited retinal diseases, and there are many genes that cause these diseases. And you can see how, we started discovering these genes in the late 80s. And, as time has gone by, the number of genes that cause these diseases have risen almost in an exponential manner. When we talk about inherited retinal diseases, there are many diseases that are classified as inherited retinal diseases. There are two specific genes, with RPGR being more common than RP2, that lead to X-linked retinitis pigmentosa. Now, the RPGR gene in particular can manifest two different types of phenotypes. One is the classic retinitis pigmentosa, and the other one is the predominant cone rot dystrophy group. So, what happens in X-linked retinitis pigmentosa? We have ultimately a loss of these receptor cells in the retina that lead to a retinal degeneration. And this retinal degeneration manifests, the phenotype of it is that there are pigment deposits called bone spicule pigment, or there's loss of retinal tissue called retinal atrophy that primarily in retinitis pigmentosa manifests in the periphery of the retina and encroaches to central vision, or the center of the retina. We can think of the stages of retinitis pigmentosa from this schematic diagram, and as you can see, when you go from a normal to a more advanced state, there is loss of those light receptor cells called the photoreceptor cells, which are at the bottom of the retina. And so the retina is no longer able to detect the light signals that form the picture that we see as our world. In terms of X-linked retinitis pigmentosa, or XLRP, really the prevalence of this, prevalence means how many people are affected, is debated. It's one of the more common forms of retinitis pigmentosa, and we think maybe about 15% of retinitis pigmentosa is from XLRP, and this is equates to about 15,000 people in the United States. And as I mentioned to you before, there are two genes that cause retinitis, XLRP, RPGR, and RP2. And the RPGR gene is more common than the RP2. And as I mentioned to you before, it can cause a retinitis pigmentosa. We call it a rod cone dystrophy, and that's in the majority of the patients. And so in these patients, peripheral vision and night vision are the initial and main complaints. And the other manifestation is the cone or the cone rod phenotype, which affects the central retina. And so the central vision, color vision, contrast sensitivity, these are affected early on in the disease, as opposed to the peripheral vision that's manifested in rod cone dystrophy. So the reason that we call this X-linked retinitis pigmentosa is because it is passed on in those sex chromosomes, and women have XX and men have XY. And as you can see, when you have what's called a pathogenic variant or a mutation in the X chromosome, the men manifest it and women don't, because they're essentially carriers. And you can see in this pedigree, the grandfather, who has a black square, has the condition, and the mother carries it, and ultimately one of the sons develops the condition. And so it's important to know that 15% of men who don't have an inheritance pattern can still have X-linked retinitis pigmentosa. This is another exception to the rule, where you see multiple generations affected, and both men and women are affected by this condition. And so you would wonder if this is really X-linked inheritance, because women seem to have this condition as well. And what we have noted is that up to 10% of families that we think this is a dominantly inherited pattern actually have X-linked retinitis pigmentosa. And the reason is that women also have a very severe manifestation that leads to loss of vision. How does X-linked retinitis pigmentosa manifest? A patient who has the cone rod phenotype would have a blur in the middle, as shown in the right photograph. And you can see for patient with X-linked retinitis pigmentosa, where the peripheral vision is blurred, how this may look like on the picture to the right. And you can see for people who have what's called ring scotoma, a ring of blurring, how this would look and make it very unsafe for driving. And you can see the picture on the right shows blind spots that are manifesting on for this patient or this individual, and how this picture may look for that person. When in clinic we see individuals affected with these conditions, we ask about a family history, because as I've said, how important a family history is in arriving at a diagnosis, when the symptoms started, how long they've had these symptoms, and how it's progressed. We do a examination. We check for visual acuity. We use what's called a slit lamp to look at the presence of cataract, any opacities in the lens, that is. We check the pressure in the eye, and then ultimately, this condition manifests in the retina. So the retinal examination is very critical. We do a number of pictures that are very helpful in monitoring and making a diagnosis. One's called an OCT, and I'll come to these pictures in a few minutes. One's a fundus photograph and autofluorescence imaging. And then we test the functioning of the retina with an electroretinogram and what's called perimetry or visual field testing. So just very quickly, this is what the clinical examination shows. Pigment deposits in the periphery. This is a picture called autofluorescence. It's essentially a black and white picture, and it shows the health of the retina. And you can see in an individual who has this condition, there is this hyperfluorescent bright ring around the center that really gives us a clue as to the presence of this condition. An electroretinogram is very essential in the beginning to make the diagnosis. We put contact lenses called Beer and Allied contact lenses on the eyes of a patient. Different labs use different electrodes. There are DTL electrodes or even skin electrodes. And what it does is it records the rod function and the cone function of the retina, and you can see what a normal electroretinogram looks like, and how in rod cone disease or cone rod disease, how this changes. And this is very crucial in the beginning of making a diagnosis. So ultimately, we need to do genetic testing to prove that an individual has this condition. By genetic testing, we can identify what other conditions are associated with a retinal disease. We can accurately classify this as X-linked retinitis pigmentosa caused by RPGR, and then we can discuss what lies ahead for these individuals who have this genetic test result that's positive. Also, we can talk about how this affects the rest of the family. What are the chances that your kids may have this condition? And then ultimately, we can talk about the eligibility for clinical trials with this condition. And with the genetic diagnosis, as I mentioned before, we can give a more accurate prognosis. So for patients who have RPGR mutations, they have this loss of vision, and the curve going upwards is a loss of vision as folks get older. And as you can see, a logMAR vision of 1 is 2200, or legal blindness, and that can occur between the ages of 40 to 50. Legal blindness can also be defined by how constricted your visual field is, if it's less than 20 degrees. And the picture on the right, what it shows is how very concordant it is between family members. These are family members that were of a similar age, and you can see the visual field on the left and the right really match, showing that what your grandfather had at age 15 is very likely what you would have at age 15, etc. These conditions are modified by other factors such as lifestyle and sun exposure, perhaps, and other genetic modifiers. But on large, you can use the relatives' vision and particularly a visual field loss, as a guide to how you may progress in life. So when we understand the genetic component that makes up the disease, we understand the biology of the disease, and we can discuss about how we can alter that biology with gene therapy or gene modification, or we might alter how that those cells are affected with other therapies such as cellular therapy and drug therapy. So when we think about clinical trials and we think about the disease you have, we can choose, we can think about modalities based on the stage your condition is at. And you can see that in earlier stages, we can correct the genetic defect with gene therapy. We can think about approaches and slowing cell death. In more late stages, then we need to think about replacing the cells with stem cells, for example, and then other therapies such as optogenetics or visual prostheses that can substitute for the lost photoreceptors. How do we assess in a clinical trial if the medication that's being given or the intervention that's being performed actually works? So BCVA is visual acuity. We want to know if the visual acuity is helped by the treatment. ERG stands for the electroretinogram. And you want to know if there's an improvement in the electroretinogram. And also in terms of safety, you want to know if there's been a deterioration in the electroretinogram after the intervention. A mobility test is having folks walk in a maze, and we sort of time them and see how often they bump into things to see if before and after treatment, if there's a difference. The full field stimulus test is a test that was recently developed and was used to show effectiveness for a different gene therapy for a different condition, and now is also widely used. And essentially, in dim light, when is it that you first notice that light is the question that test is asking you? And as I mentioned to you, a visual field test is also very powerful in terms of showing how much the disease has caused constriction in your visual field and if there's an improvement after the intervention. However, those are the more traditional tests, and we have a number of new specialized tests to see if an experimental treatment works. We can look at contrast sensitivity, we can look at color vision, we can do something called microperimetry, that is, visual, the vision sensitivity sort of testing in the very central retina. And it's a very exciting time for us as we think about how to use these specialized tests, improving or disproving that a treatment works. And finally, what's really important and that I have had the privilege of being involved in is asking the patient if a treatment has worked or not. And this can be done in a very validated, objective manner with what's known as patient-reported outcomes. And these two patient-reported outcome instruments were published in the American Journal of Ophthalmology in 2021 and have been incorporated in a number of clinical trials. Finally, I'd like to say thank you very much in being able to talk to you, and I'd like to hand it back to the studio. Thank you.
Thank you so much to Dr. Silu and Dr. Jayasundara. I'd now like to welcome our moderator for today's meeting, James Valentine, who we've gotten to know over the past several months as he's helped us plan this meeting. James has worked the last 14 years as a champion for the patient voice. James previously worked at the FDA, where he was a patient liaison, helping to incorporate the patient voice into medical product review. There, he helped to develop and launch the Patient-Focused Drug Development Initiative. In private practice, James has worked with many patient organizations to ensure their community's voices were heard by decision makers. Relevant to today's meeting, James has been involved in helping plan and moderating 3/4 of the over 55 externally led PFDD meetings. So we are in good hands with James.
Oh, well, thank you, Todd, and we're really looking forward to this session, and particularly the part of the program we're moving into now. So now that we have heard a clinical overview from a disease expert, we get to turn to what is really the core of today's meeting, which is hearing from you, people living with XLRP and their direct caregivers and family members. So patient-focused drug development, this is a more systematic way of gathering patient perspectives on your condition and on available treatments. As we heard from FDA's Dr. Silu, your input can really help inform the agency's understanding of XLRP to help inform drug development and review. While FDA has held many of its own patient-focused drug development, or PFDD, meetings, today marks the 58th externally led PFDD. With over 7,000 known rare conditions, this makes this truly a unique and important opportunity for this community. Today's meeting is interactive, so I'm going to tell you a little bit about what we'll be asking of you and how today's meeting will be organized. So first, in the morning, we'll be exploring the patient and caregiver experience of living with XLRP and its impacts on your daily life. Then, in our second session in the afternoon, we'll bring everyone back together to explore the various approaches to treatment and accommodations, including experiences in clinical trials. We will also be asking about your preferences for a future treatment. So what will those two discussions look like? Well, we'll be using a few different ways to bring your voices into the conversation. The first thing we'll do is we'll hear from panels of patients and caregivers that are people living with XLRP or caring for people with XLRP. These panelists will share their experiences and they'll help set a good foundation for the discussion. While no panel can be perfectly representative, they do reflect a range of different experiences with XLRP and with treatments, again, to help set that good foundation. Once we've heard from those panels, we'll then broaden the discussion through a facilitated audience discussion with all of you who are with us live today, our patients and caregivers who are tuned in. This will build on the foundation from the panelists. I'll be asking questions and inviting you to provide comments. This can be done through two ways. One, which is we'll be providing you with a phone number. You can dial in by phone and we'll actually talk live on the program today and hear your experiences and your preferences. You can also write in with written comments. There's a comment form on the website live today that if you scroll down under the live feed, you'll see that comment form, be able to access it and provide written comments to us that we'll be sharing throughout the course of the meeting. You'll also notice later in the program we also will have a Zoom panel of patients and caregivers also contributing to the conversation. The final way that we'll be asking you to participate is through use of polling questions. So these are for patients and caregivers only. You can open a new tab in a browser, open a new browser page, or even you can do this on your phone and go and to a web page there to follow along, whatever your preferences, whatever device you are most comfortable with. So we're actually going to get you into that system now and have you enter in the URL or the web page link that we'll be using throughout the entire day. So you can go ahead now, again, open up a new tab in your web browser, whether that's Google Chrome, Internet Explorer, Safari, type in www.pubmed.gov www.polev.com/XLRP. Again, that's www.polev.com/XLRP. We'll be getting to some polling very soon. We just wanted to go ahead and give you a chance to get a head start, get to that web page. Once you're there, we'll be there throughout. You can keep that up throughout the entire program, and we'll periodically be coming to different discussion or polling questions throughout the meeting program. So beyond today's meeting, we know that you have many ways to participate live in the meeting program. However, if you leave the meeting and you feel that there was something that you didn't get around to sharing, maybe after reflecting on the meeting, something else comes to mind, we will ask you to come back to the same meeting pages today, and for 30 days after the meeting, you can provide additional written comments. Or if you're watching this on demand after the actual live meeting, you can still provide your written comments for the next 30 days after the meeting date. All of this input from today's live meeting, as well as this written input, will be summarized in what's called a Voice of the Patient report, which will be provided to the FDA, made available for drug researchers and developers, and just for the general public. So this will be kind of a living resource and kind of summary of today's proceedings. So finally, before we move to the meat of the meeting and hear from all of you, I want to go over a few ground rules for today's discussion. We encourage individuals with XLRP, as well as their caregivers and family members, to contribute to the dialogue. That's through polling again, calling in, submitting written comments. This is limited to patients, family members, and other direct caregivers only. Our other stakeholders are staff from the FDA, drug developers, and clinicians are here to listen and to learn from all of you. I also want to mention that the views expressed today are going to be inherently personal, and the discussion may get emotional at times. So respect for one another is paramount. And to that end, I ask that you try to be focused and concise in your comments, so that way we can hear from as many voices as possible. So without further ado, let's get to our first set of polling questions for the day. This will give us an idea of who we have in our live audience. If you haven't already, open a new browser, open a new tab in your web browser. You can do this on your computer or on your phone, and go to www.polev.com/XLRP. One more time, this is www.polev.com/XLRP. Again, once you get to this web page, just keep this open throughout the whole program. Anytime we come to a new question, that question will appear there and you'll be able to answer. So our first question for you today is, where do you currently reside? Again, this is for our patients as well as family members and caregivers. Please also participate in these polling questions. The options are A, in the U.S. Pacific time zone, B, the U.S. Mountain time zone, C, the U.S. Central time zone, D, the U.S. Eastern time zone, E, U.S. Alaska time zone, F, U.S. Hawaii time zone, G, Europe, H, the Middle East, I, Asia, J, Canada, K, Mexico, or L, some other country or region not otherwise listed in the other response options. So again, we want to give everybody time to get into the system, make sure you're able to access these polling questions, and then we'll be able to have you follow along throughout the rest of the program. So what we're seeing so far is that the greatest response is in the U.S. Eastern time zone. That's option D, with about 60% of our audience in the United States in the Eastern time zone. However, so far what we have is that the U.S. Mountain and Central times are represented, as well as the U.S. Pacific time zone is represented. So we have a good kind of cross-section across the United States. I'm also pleased to see that we have participants from outside of the United States. We have participants from Asia and Canada represented. So we welcome you, and regardless of where you live, across the United States or outside, we very much look forward to hearing your voices throughout the program today. So we go to our second polling question. So here we want to know, are you or your loved one with XLRP either A, female, B, male, C, non-binary, D, you prefer not to identify, or E, other? Again, this is for any person living with XLRP or family member or other direct caregiver. Please respond, and obviously here if you are a caregiver or family member, you're answering now the questions through on behalf of or for the person with XLRP. We're not asking here for your gender identity. So far, it looks like our patients that are represented in the live audience are, about 2/3 male, a little under 1/3 female, and then a little over 5% non-binary. And we don't have any responses that prefer not to identify or identify as other. We can move to our third polling question. Here we want to know, how old are you, or if you're a caregiver, your loved one with XLRP? The options are A, 0 to 5 years of age, B, 6 to 10 years of age, C, 11 to 18 years of age, D, 19 to 30 years of age, E, 31 to 50 years of age, F, 51 to 70 years of age, or G, 71 years or older. And again, this is for the person living with XLRP, whether that's you yourself or the person that you care for. So we'll give you a few more moments here to get in your selections. I see responses are still trickling in here. So far, the age ranges that are most represented today is F, the 51 to 70 year age range, with a little over 1/3 of our audience. Close to 1/3 is option E, 31 to 50 years of age, and then about 1/5 of the audience represented is in the 19 to 30 year age range. However, we have representation across some of the other kind of bookends to that. We have, some pediatric patients, both between 6 and 10, as well as 11 and 18 years of age represented, as well as those that are 71 years of age or older. The only age range not represented today is the 0 to 5 years of age group. If we go to our final polling question from this initial kind of batch of questions, here we want to know, do you or your loved one have a genetic diagnosis? So the options are A, yes, they have a variant or mutation in the RPGR gene. B, yes, they have a variant or mutation in the RP2 gene. C, yes, they have a variant mutation in the OFD1 gene. No, they do not have a genetic diagnosis, but they have received a clinical diagnosis. Or E, if you're unsure. So we'll give a few more moments here for you to select whether you or your loved one have a genetic diagnosis, and for those that do have a genetic diagnosis, which variant or mutation that you have. So far, while any final responses come in, we are seeing that about 3/4 of the audience do have a genetic diagnosis, and they have a variant or mutation in the RPGR gene. We're seeing about 1/10 of the audience does have a genetic diagnosis, and that variant or mutation is the RP2 gene. We do have some representation for those that have a genetic diagnosis with a variant or mutation in the OFD1 gene. No one represented today only has a clinical diagnosis without a genetic diagnosis. And we do have some participants today that are unsure whether or not they or their loved one have a genetic diagnosis.
Yeah, and it looks like the person who did respond as having a variant in OFD1, they changed their response, which is not surprising. That gene is quite rare as a cause for XLRP.
Sure. Well, thank you, Todd. And so with that, we have a good sense of who is in our audience today. We're very excited to hear from you, regardless of across these 4 questions, where you fell in any of those. We want to hear the full range of the experiences, across, the genetic diagnoses, age ranges, where you live, and whatnot. So please, we want to hear from you throughout today. And so without further ado, we're going to move into that first topic that I described, what it is, learning from all of you, what it is to live with XLRP. What are the symptoms and manifestations of XLRP, and how do they impact your daily life? If we can pull up our first set of discussion questions, this will help give us a sense of the types of information we want to learn from you. And so throughout the rest of this morning's session, think about some of these things and think about calling in or writing in with some of your answers to this. So we want to know, of all the symptoms and health effects of XLRP, which of those, maybe what are the top 1 to 3 of those that have the most significant impact on you or your loved one's life? How does XLRP affect you or your loved one on best or worst days? We know that there may be variability from one day to the next, and so we want to know what that looks like. We also know that this disease can change over time. So we want to know specifically for you or your loved one, how have their symptoms changed over time? And how has the ability to cope or accommodate those symptoms changing over time changed as well? We want to not only learn a lot about how the disease and its manifestations actually change, but we want to know what that actually looks like and how that impacts your life. So what specific activities that are important to you or your loved one are they or you not able to do maybe at all or as fully as you would like because of XLRP? And finally, knowing that, of course, you have a lot of experience living with XLRP, we also know that you're always thinking about your future living with XLRP. So we want to know, what do you fear the most as you or your loved one gets older, or what worries do you have about the future? So to get us started on this topic, I'd like to welcome our first panel of your peers, some patients and caregivers who will be sharing their experiences. We have Jonathan, William, Joaquin, and Greg. So Jonathan, take it away.
Hi, my name is Dr. Jonathan Tamayev. I'm 27 years old and I have X-linked RP. My life with RP has been the exception and not the rule. I was diagnosed around age 13, freshman year in high school, a time when one begins to form the adult identity and begins to plan for the future. Up until that point, my vision was not a real issue in my life, but I had a cousin 10 years my senior living with RP, and I was noticing some trouble seeing in the dark. The typical course for RP is losing first your night vision, followed by peripheral vision, and then eventually your central vision. Knowing my cousin had a genetic condition and noticing my own night vision issues, I knew walking into the ophthalmologist's office that the chance of me being diagnosed with RP was high. But when the words hit me, and I was informed that I need to seriously reconsider my future and brace for blindness by the age of 40, I was devastated. For a while I was mad, sad, and upset with the world. However, I quickly realized I didn't have the time to be upset, and decided very early on that by the time I'm 40, my life will be where I want it to be. I went on to study behavioral neuroscience in undergrad, and became extensively involved in research in both behavioral neuroscience and molecular genetics. I graduated magna cum laude from Hunter College. I went on to medical school at the Technion Faculty of Medicine in Haifa, Israel. During my time in medical school, I obtained a position working in a Retinitis Pigmentosa research lab. The research focused on identifying unknown genetic variants of RP in patients who would not test positive for any previously identified genetic causes. Making this identification for patients would allow them to be eligible for genetic treatments once they are available. This was very personal and fulfilling work. Upon graduating medical school, I proceeded with a career in psychiatry, a field of medicine where I could have a lasting clinical role without my vision. At this time, I'm beginning my third year of residency at SUNY Downstate. I have a wonderful, supportive wife, and I'm about to have my second daughter at the end of June. As I said earlier, my journey with RP is different from most, because I knew when I was very young my prognosis, and it shaped each and every decision of my life to this point. I now face the decision of using IVF for all future pregnancies, because with each girl I bring into this world, I am bringing in another carrier of RP, someone who will continue to propagate this hardship. Given the nature of X-linked RP, all my daughters will be carriers of the disease, and all sons that I would have would not inherit it. And I already have 2 girls now, so I've seen what this has done to my cousin, who is now 40 years old, legally blind, twice divorced, unemployed, and multiple issues with different substances. Not everyone's built to face these challenges, and that's the reality. None of this journey has been easy. Due to my inability to drive at night, I rely on public transportation to commute for almost 2 hours each way across East Brooklyn. Residency hours are unforgiving. I work 24-hour shifts, overnight shifts, often come in during very early hours and leave very late at night. I had ranked the program I'm at in Brooklyn over opportunities in the Cleveland Clinic or Emory because I did not feel comfortable living in a city where I could not safely rely on public transportation. I got married early and had kids early because this was what I felt I needed to do to ensure a happy life in my condition. I'm blessed to have a supportive wife, fulfilling career, an amazing daughter, with another one on the way soon. Every major decision in my life has been dictated by the ticking time bomb that is my vision. There are no breaks, there's no time for rest. The disease is insidious. Each day I see slightly less than the day before. I gave up driving at night 1 year after obtaining my license. The list of ways RP has impacted my life is endless. Not driving at night was just the beginning. The constant fear of when I will lose another crucial means of independence lingers over me. What will happen when I can no longer drive at all? What will happen when I can no longer see my kids' faces? What will happen when I can no longer see my computer screen? I cope by proactively taking steps to secure and maintain my independence, but I live with the constant fear that one day I won't be able to stay in front of it. I told myself at a young age I would never allow myself to hope for a cure. I would constantly be sent links by family to pseudoscience treatments in Russia, South America, Europe, that were obviously scams. I'm in a place in my life now where I have the ability to critically evaluate the research out there. At this point, I went back on my word to myself. I am hopeful. I do not need to lose my vision. This is becoming more and more clear each day. However, each day that the treatment is delayed, I am one step closer to irreversible blindness. I've been applying for clinical studies because I see real hope in them. However, the spots are very limited and the inclusion criteria are very specific. Imagine that you knew that there exists a treatment that can stop or even slow the progression of blindness, and it's sitting in a freezer in a lab somewhere, and bureaucracy and red tape is keeping you away from it until potentially it's too late. The impact the treatment would have is immeasurable. I want to see my children. I want to enjoy the fruits of all the hard work I've invested in my future. I want to travel, I want to explore, I want to continue to see. Thank you for your time.
Hello, my name is William Hartman. I live in St. Louis, Missouri, and I'm a customer success manager for a software company that develops enterprise resource planning and supply chain software for manufacturing companies and other large organizations. Prior to this role, I had worked for about 24 years, mostly as a software project manager, where I would lead and manage the implementation of software-based solutions in the logistics and supply chain space. I worked from home since about 2001. Prior to the COVID pandemic, my work required me to travel about 20% of the time to meet with my customers, tour their warehouses and manufacturing facilities, and discuss and document processes and business requirements to create a plan and schedule to deliver the solution. I'm 50 now. I was diagnosed with XLRP around the age of 6. My parents noticed that I would often trip or bump into things when moving into dimly lit areas, such as a movie theater or even just around the yard or house at night. In 2014, I was genetically tested and confirmed with an RPGR version of XLRP. I would say that the most challenging symptom of XLRP is always the one I don't know about that's coming next. I think the medical community calls it progression. I just call it the surprise.
I never know what XLRP is going to take away from my visual capability next, but I always know it gives nothing back. Surprise, I'm taking away your night vision. Don't venture out or try to attend any social events at night by yourself. You'll feel a sharp, thorny sting at the partial loss of independence, but the pain will not go away. The pain will be ever present and will spread as you realize people increasingly isolate you and treat you differently. Surprise, I'm taking away your ability to find something that you just set down in front of yourself. Trust me, it's there. You just won't see it until you look at the same area many times and it magically reappears. You'll do this in front of other people, and you'll feel the sting of a new thorn puncturing your confidence, another wound that will grow and steadily erode your self-esteem throughout your life. Surprise, starting today, under all lighting conditions, I'm going to make you look very clumsy in a public crowd of people. Try not to bump into them so much. I suggest you look around yourself 3 to 4 times every time before you dare take a single step. Do you feel the confidence wound bleeding, getting bigger? Surprise, I'm taking away your ability to drive. You better talk to your family and your boss about this. Try not to sound sorry for yourself as a new thorn suddenly and violently slashes deep into your sense of pride. The gaping wound leaves you in shock and breathless. No more driving to work, no more driving to get groceries, no more driving for kid drop-offs or pickups at school, no more driving the kids to practice or games. Your wounds are now so deep and big that they are converging, stripping you of the image you once had of yourself. Surprise, I'm greatly reducing your ability to see colors and shades. Time for another humbling chat with your family and boss. Surprise, I'm now working on reducing your central vision. Aren't your family and boss tired of hearing from you? Try not to sound sorry for yourself. You just want to be able to do your job like everyone else, but you find it difficult to concentrate. You are bereft of your independence, having such little confidence, such little pride and self-esteem left. You are consumed by your thoughts. There are coping mechanisms for each symptom that comes up, but individual symptoms are not the most challenging part of having XLRP. The most difficult aspect of XLRP is the ever-changing nature of the symptoms and the ever-increasing disability. I recognized long ago that my coping mechanisms are only temporarily useful at best. If there were only a way to stop the progression, I would at least have some semblance of control over my future. I would be able to set expectations more clearly in my family and my work life. At present, I must use assistive technologies on my computer, especially larger fonts and high contrast themes, in order to do my work. Some of my most difficult days are yet ahead. Soon, I'll have to travel and meet my new coworkers and managers. I don't look forward to the task of trying to put them at ease with my visual impairment or the various difficulties in social interaction. This usually entails me making an announcement about my disability many times and asking various people for assistance, all the while putting on a strong face and assuring them that I'm fit for the job. In my personal life, some of my most difficult days are just spent trying to triage paper mail. It's recently become very difficult for me to read regular mail, and it triggers a fear in me of completely losing all vision one day. Here I am after 50 years of XLRP progression. It has left me with wounds exposed for all to see. XLRP has taken and continues to take so much from me. I will continue to fight back, and find ways to cope in the hope that one day very soon, there will be a treatment to halt the progression. That would finally allow me to catch my breath from the relentless race to deal with the ever-increasing disabilities inflicted by XLRP. That would allow me to experience a brief moment of peace from the years of XLRP distress.
Hello, my name is Joaquin Cornejo. I am 41 years old, and I was born with RP, XLRP. I was very young, around 5 or 6 years old, when I first remember noticing there was something wrong with my vision. I remember playing tag or hide and seek with other children, and I couldn't understand how they could see at night. They would just stand, I would just stand there and they would just disappear into the night to go hide. I don't remember my parents telling me about my RP or my XLRP. I went to regular eye doctors growing up, and while I knew something was wrong with my vision, there was nothing really they could do to help me. Even when I was in grade school, other kids made fun of me for bumping into stuff, but they didn't know my situation. Neither did I. I really didn't understand it. Even the teachers didn't know. They just sat me in front of the classroom, and that was as best they could do for me. It was still challenging. In elementary, I didn't have many issues seeing the board because they used a chalkboard. But in high school, and they used a whiteboard, that's when it got difficult for me, even sitting in the front. I really couldn't see what was on the board. Or even watching movies in school, when they would turn off the lights. I wouldn't get up to, let's say, go to the restroom because I couldn't navigate my way back to the seat. So I would just hold it. Graduating high school was really challenging due to my vision and my RP. And even when I went to college, that was even more difficult. And college was even tougher because I didn't know I could ask for help. My symptoms remained stable for the rest of my life, for part of my life. I had to renew my license every year or two because of my vision. But around 3 years ago, when I was like around 38, I would have to scan constantly and like turn my whole head left or right to just to see. But even then, that was not good enough. The sun started to get too bright for me. Even with prescription sunglasses. I used to be fine during the day walking around by myself, but now I use a walking cane just so I don't, hurt myself. Even in my house, I use 100 LED light bulbs. But once I stopped driving, I had to quit all that. But there was no way I could drive all over California. So I tried working at a body shop, but I had to stop working there because I kept bumping into stuff, hurting my shins, cutting myself. So I just stopped working there entirely. And I thought I was just going to be on my couch for the rest of my life. I thought what I was experiencing was normal, but I was just at home on the couch getting disability benefits and asking my eye doctor, and my doctor just pretty much telling me, hey, tough luck. There's nothing that there's nothing he can do to help me. So I jumped on the web and started looking for jobs for blind people. What did blind people do for jobs or careers? But there was not enough research until I found Valley Center for the Blind here in Fresno, California. I started to go there for on and off for computer training for people who are blind. I already had some computer training in high school, but Valley Center for the Blind really helped me. And then about 2 years after going with them, they offered me a job. And it's been such a blessing for Valley Center for the Blind to help me. But what's most frustrating is just being here for my family. I just can't leave my job at the drop of a hat like a normal sighted person would to go pick up their kid if they're sick. So I just get the feeling it's like, hey, don't count on dad. He can't help us. I got a 22-year-old son, I got a 16-year-old son, and I got, my princess. She's 11 years old. And, I was really outdoors with them. And I can't do that no more. I can't go outside, ride a bike. I can't play basketball, softball. I just can't do outdoor walks with the family. It's just really hard. My daughter tries to show me stuff. She's really excited, and I just can't see what she's showing me. Or if me and my wife had a night, she asked me, what does she look like, and how does she look, and does she look pretty, and I really can't tell what she looks like. I just tell her, she looks beautiful, and my family don't know the full extent of my vision. I haven't told them. I'm just trying to, trying to be strong for them and not let them worry about me. And XLRP, it's just killing me inside. I just hope someday, someone can help people like me, help us out. Thank you.
Hello, my name is Greg DeBecke. My wife Paula, our son Marty, and my brother-in-law Wally each have X-linked retinitis pigmentosa. As you are likely aware, XLRP is an inherited retinal degenerative disease. Diseases like to rob you of what you already have. XLRP robs you of your vision, slowly, over time, until you're blind. Everybody has something they're dealing with, right? And we as humans are resilient and built to overcome challenges like this. I usually try to convince myself. I get it, but Marty's not going to get to drive. Will he find friends who accept him? Will he be able to play sports? Will he be able to read? Will he find a career? Will he consider having children of his own or choose not to, so he doesn't pass this eyesight-robbing disease on to his daughters, who may become carriers? And what about Paula? Not only does she share the same anxiety and frustration that I do about Marty, her worries are exponentially greater as she ponders daily her own challenges and what's to come with her own progressive vision loss. And so my internal dialogue goes, as it has for the past 28 years, wondering, waiting, worrying about my wife and son's progressive vision loss because of XLRP. For half my life now, this insidious disease and how it affects loved ones, friends, and others is the first thing I think about in the morning, what I think about regularly throughout the day, and the last thing I think about before sleep. Witnessing one loved one struggle with progressive vision loss is not something I wish on anyone. Witnessing 3 is nearly unbearable. Marty was never able to play sports he wanted to as a younger child. Any sport with a ball was impossible and often unsafe. He'll never drive and will never be able to see in a dimly lit room, let alone at dark. His visual world is closing in on him daily. As he prepares now for a career which in itself is difficult for someone with a visual impairment, he also needs to consider a career that he can adapt to. This weighs very heavily on Marty. If you ask anyone affected by a progressive disease and what is most frustrating and scary to them, they'll tell you that it takes what you already have. My wife, son, and brother-in-law all have lost vision that they once had and continue to do so. It's a continuous cycle of having, losing, overcoming, and then losing some more. The frustration and fear become palpable. Even on the best of days, this disease rears its ugly head and reminds you that blindness ensues. I recall often vacationing with family friends, a time when kids are carefree and beyond joyous. On one vacation, when Marty was young, we entered a dimly lit restaurant at the end of a great day at the beach. The restaurant lighting was not something our son previously had difficulty with. But even at his young age, he lost enough low vision by this time in his young life that he couldn't navigate well enough to avoid a pole in the middle of the room, running face first into that pole. Sadly, this was to the amusement of his friends and unknown patrons in the restaurant, both thinking he was simply awkward and not that he had challenges they didn't. Embarrassment followed, by fear dictated the remainder of the vacation and carried over into regular life. My family's journey with XLRP began 28 years ago when I met my wife, and she shared with me she had poor eyesight and that her brother was legally blind. This was hard to understand as a seeing person with overall good vision. Not the wiser, I mistakenly thought and naively believed you either had eyesight or you didn't. Most folks who claimed to have poor eyesight were fine with corrective lenses. My wife seemingly had full vision at that time. I didn't know her vision loss caused anxiety whenever she was in an unfamiliar environment. Stairs, traffic, obstacles are drivers of anxiety then and are especially now. As time went on, Paul and I educated ourselves much more about this disease. It wasn't until we found the Foundation Fighting Blindness that we began to understand a bit more about XLRP and how it could impact our lives. After we were married, the science around understanding XLRP continued to improve, and we found ourselves not only wondering what this disease could mean for us, but also our future family, leaving us with the very unenviable decision as to whether we should have children of our own. Of course, passing to a son would mean he would ultimately go blind. Passing to a daughter would make her a carrier and possibly affect her eyesight like it does Paula. What's more is we'd be putting our children in the same position we're in, deciding if growing a family was the right thing to do. Resilience is what we as humans have. This is good because it's needed while living a life of uncertainty. Living a life that basically requires eyesight to be accepted and to do the things that we as sighted people very much take for granted. Thank you very much for considering this and hearing me.
Wow. Thank you, Greg, and to all of our panelists for being so brave and being the first to share your personal experiences of living with XLRP with all of us this morning. It really will set, I think, a great foundation for this discussion, which now we're at the portion of the meeting where it's the first time we get to hear from all of you that are with us in the live audience, the people living with XLRP and their caregivers and family members. If you have been thinking about those discussion questions, you've heard some panelists, and you have something that you'd like to share, I'd like to encourage you to go ahead and start calling in at this point. That phone number is 1-703-844-3231. We'll be reading this throughout the program today, but if you want to jot it down for now or for later, it's 1-703-844-3231. You can call in at any point during the program and contribute to the conversation. We'll be giving you reminders throughout. Your other option is at any point you can also submit a written comment. If you scroll down below the live stream of this meeting, you will be able to find a comment box where you can submit a comment, and you can submit multiple comments throughout the day today as we move through different discussion topics. But to get us thinking about this first topic that we're exploring of, what are the symptom and health effects that most impact you or your loved one, we're going to start with some polling questions. So for those of you who were with us, you can go to that tab or browser that you had open. If not, if you've just joined us recently, you can open up a new tab or a new browser web page and go type in the following web link, which is www.polev.com/XLRP. And just keep this page open throughout the program today. One more time, that's www.polev.com/XLRP. These polling questions are for our patients and our caregiver participants. So in this first question here, in this topic on what it is to live with XLRP, we'd like to know which of the following XLRP-related health concerns have you or your loved one ever had? And here you can select all that apply. The options are A, decreased night vision, B, difficulty adapting to changes in lighting, C, discomfort from bright lighting, or also known as photophobia, D, loss of peripheral vision, E, loss of central vision, F, anxiety or depression, or G, some other health concern related to your XLRP that's not otherwise listed as a response option for this question. So we'll give you a few moments here to tick off each of these different XLRP related health concerns that you or your loved one have ever had. So while results are still trickling in so far, it looks like we're seeing actually each of these is being selected by quite a few people. One thing I should note is that when we have a question where our audience can select more than one option, what we're seeing is a percentage of the total responses, not a percentage of people who have selected any one response. So you can think of these bars as a type of ranking, but don't think that only, for example, 21% of people have decreased night vision. That's 21% of the total responses. So what we're seeing now is that we are having the highest two XLRP-related health concerns are pretty neck and neck. That's A and B, so decreased night vision and difficulty adapting to changes in lighting. Close behind that is C and D. We have discomfort from bright lighting as well as loss of peripheral vision. And then maybe, they're all pretty selected by quite a few people, but if I had to say it's kind of like the next tier, it would be E and F, loss of central vision and anxiety or depression. We did not have anyone select some other XLRP related health concern. So if we go to our next polling question, you'll recognize the response options here. It's the same from the last question, but instead of selecting all that you or your loved one have experienced, here we want you to select the top 3 most troublesome XLRP-related health concerns that you or your loved one have ever had. So again, you're picking the top 3 that are most troublesome for you or your loved one in your daily lives. So the options again are A, decreased night vision, B, difficulty adapting to changes in lighting, C, discomfort from bright lighting or photophobia, D, loss of peripheral vision, E, loss of central vision, F, anxiety or depression, or G, if some other XLRP-related health concern is one of your top 3 most troublesome. You can select that here. So now this one might be a little harder because I can imagine after seeing the last responses to the last question, there's quite a burden of many of these different health concerns for many people, given that they were only slightly staggered, I would say. But now to say which are the most troublesome, I want you to be thinking about why you're picking these top 3, and we want to encourage you to call in and write in to help explain why you've selected those that you have. As it stands, A, decreased night vision, appears to be the top most troublesome of people's top 3s. After that, it looks like loss of peripheral vision and difficulty adapting to changes in lighting are most troublesome. And then maybe in the number 4 spot, we're seeing loss of central vision. What really stands out to me is that everything here are in a number of participants' top 3, meaning of all these things that they experience, these are the things that most trouble them in their daily lives. And we do even see some others popping up here. So if you were one of those people who picked other, we want to hear what those health concerns are and why those are most troublesome. So I want to thank you. Oh, Todd,
sorry, James, if I can add, the top 3 here are quite consistent with what we've observed in our own internal survey of individuals with XLRP, that being decreased night vision and difficulty adapting to changes in lighting and loss of peripheral vision seem to be quite commonly reported in folks in our survey.
Sure. Thank you, Todd. So I want to thank everybody for participating in this polling. Again, we'll come back to those questions periodically throughout today's session, so you can keep those web pages or tabs open, and we'll let you know when we have new questions for you. I also want to see and I want to welcome a panel of your peers who are on live via Zoom with us. Before we go and check in with them and hear some of their thoughts on their responses to those polling questions, I want to again encourage you to call in or write in Again, that phone number is 1-703-844-3231. We very much want to hear your thoughts on which of those health concerns were your top three and why. But now I'm going to come here. Maybe Michael, start with you. As you were, as you're thinking about the top, one or two, maybe let's narrow it a little bit, top, one or two health concerns related to XLRP that either you have now or you've had in the past. Which of those are most troublesome for you and why?
Gosh, thank you, Michael Stone. It's forever changing, but I would say definitely changing in light conditions, along with the anxiety and depression that comes along with it. It permeates every aspect of our lives.
Sure. So let me first explore these two that you just noted now. One, the changing, of light. Why is that troublesome for you? Can you help us understand that?
Well, it's constant, okay, and it's in every aspect of our lives. It's not just outside or inside. It's going inside, going outside. It's obviously trying to utilize anything digital, and such. There is absolutely no aspect of life that doesn't involve light, and it is constantly changing. And we obviously can't move fast enough to adapt, and so it's a degree of blindness and how bad it is. Mm-hmm. And the interesting thing is that it's constantly changing. Like, for example, I was one of those people who started with bright lights were always my problem. Dim lights weren't until that became a problem. And then I was able to hear feel exactly what everybody else, all my peers were already feeling. And it happened very quickly. And just to walk into a room and realize I could see nothing. And yet I knew the lights were on.
Wow. Can you maybe give an example, to help illustrate, whether it's, a time that you, kind of walk into a room and what that experience is like, or trying to turn on a cell phone and have that, I think you mentioned, digital devices and, having, light illuminate from those. Kind of what does that look like, feel like for you? Is there an example you can share where, that has been troublesome, since it is your top symptom or health effect?
I think, it literally is in everything. And one of the hardest things to remember, what it could be something as innocuous as putting toothpaste on your toothbrush, or trying to cook your food in a kitchen, where there's a safety concern to it. So anytime there's a safety concern, the first time though that I really noticed it, where I would feel like my hands clenching and becoming fearful, were in more social situations, walking into a room where you have no idea what the lighting may or may not be. And of course, now you're going to be in a scenario where there may be food, knocking things over, spilling things amongst that. But I will say, anytime there's a safety thing, I will tell you that work has been amongst the toughest, because that was something that you would think that you'd be able to control, because it would be something constant, but even there it wasn't.
Right.
Yeah.
Yeah. And then on the other one that you mentioned is the anxiety and depression. Is that something that's been a concern for you, or something you've experienced for some time, or is that more recent?
It's always been there. Sometimes I like to think of it as a lowercase a. It's always going to be there on a mild front, but then there's the moments where it's high. I'll tell you where it became high is when I really noticed the fight or flight. We live in a world right now where people are very distracted. They're not paying attention. Whether or not I'm with my service dog or with a cane, they don't recognize what that is. And so what's happening and is that I've been in this almost the state of fight or flight, because it's a constant safety issue. Cars are not stopping at stop signs where you expect them to be. People just bumping into and can be quite violent, actually. So unfortunately, what used to be kind of a mild anxiety depression that just, from losing independence is now a perpetual safety thing. And whether or not you don't ever have an opportunity to leave it behind. It's wherever you go. And I mean, I could literally cite hundreds of examples.
Right. Yeah, I realize that, asking, for a specific example when it's, you're describing it as ubiquitous in daily life, is tricky. But thank you so much, Michael. Lisa, I saw you nodding your head there when you're thinking about your top, most troublesome health concerns. What is top of your mind? Is it similar, different than
well,
Michael?
First, I just wanted to comment on what Michael said in regards to getting hit by a car and navigating in the world. My dad was just hit last month. Most people who are blind at some point do get hit by a car, in my experience, and because people are very distracted. This is a huge problem, and a lot of the cars are becoming close to silent, which makes it even harder for our population. But going back to the question, my top two were being able to see at night, because that affects daily life on so many levels for me as a mom who's trying to pick up kids from school, get them to extracurricular activities, and get home before it gets dark. The other one I was kind of torn about was the bright lights. I am photophobic, and it is quite extreme. I did pass out in my ERG when I was first diagnosed at 22 years old. And that changing light level affects the brightness too. So I remember being at a Blue Man Group concert, and the bright white lights really got to me, and I passed out. And everybody thought I was drunk, but I don't drink alcohol. And it was just the bright lights. They really affected me. So I'm living a life where I'm not sure where bright lights are all of a sudden going to intervene. So I'm still driving, even though I'm just starting to get cane training now. And there are lots of times where the sun is coming down in the earlier evening or later afternoon, and it's so bright that if my windshield isn't totally clean, I will get a whiteout experience. I just can't see anything.
I see.
So, and so I make sure that my car is immaculate when I'm driving it, because that's really important.
Right.
And that wasn't so much an issue, maybe 5 years ago, but that's definitely an issue now. So I have to think about, when am I driving? Am I going to be able to plan my day so that I know I'm going to be safely back home in winter by 4:30 p.m.
Right.
And life restricts you so much if you have to keep watching the clock. And then I also look on my phone app and I look for when sunset is, and my life is dictated by that.
Yeah, and Lisa, can you maybe help us understand when you're talking about night, like, are you talking about dusk? Are you talking about what is what degree of darkness?
Yeah, it's interesting because it's actually more of a problem earlier on now. It used to be a problem only when it was close to nightfall. But now I have to deal with the sun coming and hitting underneath my visor and hitting me in the face, even with sunglasses on. And then sometimes I'm finding it's this light dark game that I'm playing. Sunglasses on, oops, sunglasses off, regular glasses on, quick, because we're going through a tunnel, or, the light level is changing because of trees. So it's kind of crazy to have both glasses ready there, whipping one out after the other. But that's the life I've, started to live. And it's definitely transitional. And as was said earlier, you're constantly trying to transition to some new game that X-linked RP is playing. And, it's a challenge that way. It really is.
And Lisa, for you, you mentioned that, just so we have some sense of like the timing and course of all of this, about how long from when it was, you're really only limited to like nightfall to now where you're, even combating like sunset, what is the, how long has it been for the course of that transition?
I would say that's been over the last probably year and a half, I've been noticing that that's a lot more of a problem.
Wow.
And I should mention too that I was diagnosed at 22 years old, had no affect until 32 when I almost hit someone at night, not realizing I had lost my night vision.
Oh, wow.
At which point I went back in and found out I had a 50% expression of X-linked RP and that I was a symptomatic carrier. And in my family, X-linked RP is not a new thing. I mean, there's 15 of us who have been diagnosed over 5 generations. It's part of my identity, what I'm going through in it. Many of my family members have been through it, and we're like a big support group. We can talk to each other, and we're lucky we have each other because it's not easy.
Yeah. Well, thank you so much, Lisa. I do notice that we have a caller who is himself affected, as well as some of his family members. I think something we will hear a lot of today, but wants to share some of his experiences and health effects that he and his family experience. That's Robert from Colorado, who I'd like to welcome to the program. So Robert, are you with us?
I'm here. Thank you. Thank you for listening. I wanted to start off saying the 6 questions on the polling was which are your highlights, and I wanted to select all of the above.
Yeah.
So it was 1, 2, 3, and I didn't get a chance to say, oh no, 4, 5, and 6 were even higher. In any case, my experience over my lifetime, I'm 55, diagnosed with XLRP at the age of 14, experiencing my vision loss long before I was diagnosed. By the time I got my diagnosis, I had low self-esteem, seriously considering trying to kill myself because I couldn't participate in life like my brothers and sisters and my friends and, classmates. Can't play hide and go seek, can't see in the dark. It was horrible at sports, as discussed by, one of our other panelists. And so getting the diagnosis was a relief because it was my eyes and not me. So there was something wrong. And so that led to, is this something that could be fixed? And now and way back, in the day was, no, not right now, but we're doing research. And so we're here at this exciting point in time where we actually have the genetics and we can tell what this is. And with X-linked RP, I have a sister, is a few years younger than I, also significant vision loss. I have another sister as a carrier. She is now starting to experience vision loss as an older lady.
Yes.
And unfortunately, I passed this gene on to a son, which is next to impossible, but he has an extra X chromosome, and now he's at risk of having X-linked RP with vision loss. And he's saying he's experiencing loss of vision in the dark. And so we're having that checked out.
Wow.
The constant change of XLRP in my life I thought I could see, and coming to have peripheral vision testing, finding out that no, there's significant loss of peripheral vision, and how that has led through my life of now it's affecting my central vision. And about the only vision I have left is a little ability to see my computer screen to continue to do my job. And that's getting more and more difficult, and having to use technology screen reader. And I am concerned about how long am I going to be able to do the job that I do, sitting in front of a computer screen all day long?
Yeah.
I have skills. I have intelligence. I have the ability to work.
Yes.
And yet the challenges for folks with low vision and blindness in this country right now, is even around the globe, is challenging, very, very challenging. And we're trying to figure out what is the future going to hold for my family. I'm the sole breadwinner and supporting my wife and my 2 kids, my 2 boys, and it's treatment and restoration of vision is important to me.
Yeah.
I know that I can survive with my white cane and the technology that we have now as a person with no vision. I know that I can do that, but we live in a visual world, and I know what I'm losing. I know that I've never been able to play catch with my kids. I've never been able to go on a bike ride with my kids.
No,
So Yeah.
Yeah, I mean, thank you for sharing this, Robert. If you don't mind me asking, one thing that kind of I was curious about is you were saying you wish, kind of going back to something you started saying, you wish you could have selected them all as the top most burdensome. Is that in part because, they're really, occurring at once, and so, it's not one of those in isolation that's impacting your daily life, but really the combination of them, and if that is kind of true or accurate, can you maybe talk about that a little bit and what that experience is like?
I would definitely, of all of those 6, I have experienced all 6 of those over my 40 years of knowing I have XLRP.
Yes.
Knowing this, say the anxiety/depression is certainly fluctuates as an importance. It's a side effect of having low vision.
Right.
And so I would say it's more along the lines of a spectrum, and how all of these affect your inability to see in low light and transition from bright to dark affects all of the things that I deal with.
Right.
Leaving my house, going into businesses, going into restaurants, stores, whatever that case might be. And so the lack of night vision is your inability to transition between light. My lack of central vision is this inability to actually read labels in the grocery store, right, or find the signs to say where I need to go.
Sure.
So they all are, along the spectrum, affect the entire daily living experience. Right. And so it varies from, one end to the other. And so, super bright light becomes unbearable because, wow, this is too bright. It used to be, we can't make it bright enough. And right. So, it's hard to say which one is the most impactful.
Yes.
Because it is a spectrum and it is fluctuating throughout the day. Yeah. So.
Yeah, no, that's incredibly helpful to understand. So I just want to thank you so much, Robert, for giving us that really valuable input. I see that we actually have a lot of comments coming in, so I want to check in with Todd. What are we seeing in terms of some of the symptoms and health concerns?
Yeah, we have several folks have written in, and we'd like to share some of those with you. Adam in Minneapolis writes, while vision loss and night blindness are the major symptoms of RP, the trauma produced by dealing with these symptoms is the most challenging symptom of all. All of the bumps and bruises or worse from spills and accidents leave marks on the body and spirit. And we've also got a comment here from a caregiver, which I think is a really valuable insight to have early in the program today. Polly writes, my 10-year-old son was diagnosed with RP 6 months ago. Night blindness is the most significant symptom for him at this point. And also Jeffrey writes in from New Jersey, and this gets back to some of the other points our panelists have made. I would say my loss of night vision, trouble distinguishing colors, and inability to process images are the most significant symptoms. Losing my night vision has made it very hard for me to function in dimly lit situations. Having trouble distinguishing colors and processing images makes it very hard for me to see pictures, watch TV, or recognize faces.
Wow. Well, thank you for those of you that have written in. We'll continue to share some of your comments throughout the day today, so please keep them coming, and we'll look forward to being able to hear as many voices as possible. I see we have another phone caller, Tim from West Virginia, who wants to speak to some of the day-to-day symptoms and concerns. So I'd like to welcome Tim to the program. Tim, are you with us?
Yeah, I'm here.
Welcome.
You can hear me okay?
We can hear you loud and clear.
Okay, yeah, I'm Tim Hill. I'm from the third world state of West Virginia. And I've had, I think I was diagnosed with RP at like age 6. I've never had any night vision, and I've only had like 9 degrees peripheral vision. I had I had like 20/50 vision up until about 10 years ago, and since then I've been rapidly losing my eyesight, and I wasn't even able to fill out the poll question. I mean, I can't tell. I couldn't see them or, even find out where I was supposed to go to fill out the poll questions. And also, I recently tried to sign up for a clinical study, but I was told that my eyesight was too bad, that they wouldn't take me. So I have did the genetic testing, and I know that the defective gene that I have is RPGR-ORF15.
Right.
Now I've tried all kinds of different devices. I mean, just about everything out there.
So Tim,
and none of them have been able to help me.
Yeah. So I want to probe a little bit on. You mentioned you've always had night blindness. You have impacts on peripheral vision. When you're thinking about some of these different aspects of vision loss that you've experienced, would you be able to say that any one or two of them are most troublesome or impactful on your what you're able to do in your daily life? Are they all pretty equal?
Well, right now there's not a whole lot I can do. I mean, I'm lucky to be able to fix some of my own meals, and I mean, I have to have someone come in and clean my house, and I'm not able to watch TV. Like I said, I've tried many different devices,
right,
and none of them have worked.
Yeah. Well, thank you so much, Tim. I know you'll be joining us on a Zoom panel later. We'll get into some of those treatment experiences, but I just want to thank you for also calling in and sharing some of those top symptoms and health effects. I want to expand the conversation. Of course, we're going to continue to understand these different health concerns related to XLRP, but I want to broaden that to focus a little bit more on some of the activities in daily life, that are important to you that maybe you're not able to do at all or as fully as you would like, or maybe were able to in the past as a result of XLRP. And so to get us thinking about this question, we're going to go back to polling. So go to that browser that you had open. You can, if you haven't done this yet, or maybe if you accidentally closed it out, you can type in www.pollev.com/XLRP. And the question that we have for you now is, what specific activities of daily life that are important to you or your loved one that you or they are not able to do or struggle to do due to XLRP? And here we want you to select the top 3 things that are important to you, that top things that are important to you that either you're not able to do or struggle to do. The options are A, driving, B, walking or ambulating, C, self-care or chores, D, reading, E, travel or vacationing, F, spending time outdoors, G, participating in social engagements or social events, H, participating in sports or other recreational activities, I, attending school or having a job, or J, some other specific activity of daily life that's important to you that either you're not able to do or struggle with due to XLRP, that you would select as a top 3. And so, here, this isn't necessarily the things that are most affected, but the things that are really important to you that you would view as being impacted. So the top 3 most important things. And again, as with all of these polling questions, we're always wanting to know the why. How, I guess in this case, the how and the why. How has your XLRP impacted your ability to do this activity? And why is this one important to you? And how does this, difficulty with the activity impact your daily life? So I know that these questions, these ranking questions are hard. We've heard that already. That's understandable. But let's talk about what we have so far. So what we're seeing, and again, these are percentages of responses. I would say by far the top activity of daily life that's important, that is impacted, a top 3 impacted activity is driving. We're seeing that bar far above others. After that, we see, perhaps, the second is participating in social engagements and social events, followed by participating in sports or recreational activities. And then really, the other, a few others are clustered around that with reading, travel and vacationing, and attending school or having a job. Some that were still in a number of people's top three, but overall selected less frequently are walking and self-care, as well as spending time outdoors. We do have some other specific activities that were selected as well, things that weren't on the slide or a response option, and so we'd love to hear about those as well. But kind of striking to see, one thing really rising to the top with driving. So definitely want to hear the different ways that impacts your daily life. So I want to come back to our Zoom panel and bring in others to this conversation. So maybe we'll start with you, Andrea, as you were, looking and thinking about, the impacts of XLRP and, what important activities are, most impacted and are important to you. What stood out to you as maybe a top impacted activity?
Right now, the top impacted activity is working, making a living. So just maintaining my job, which is, a computer. I'm on a computer and in front of a screen, a good amount of the time. So that's like the top one
Right.
for me to be able to work. And I'm going to school for my job, my job. So doing school, virtually, like online or any type of, screens, things like that. Definitely, this has definitely impacted. So.
Sure. No, that's really important for us to understand, impacting on school and work, being critical, important aspects of life. Can you tell us a little bit about your XLRP and what, kind of aspects of it make it, more difficult to work, whether that's travel to work, or you mentioned you're kind of in front of a computer, difficult to do work activities or school activities?
So the biggest thing is just, again, the same thing, ping-ponging back from, the eyes adjusting to dark and then also processing light. So, I, want to scramble and do everything that, requires you to process light. And so my eyes are tired, exhausted, and then in the dark, I can't see, to drive. So.
Right. I think this is the first time I've heard, talking about kind of your eyes being exhausted, kind of as a experience with XLRP. Does that have any impact on, the timing of your work, how long you can work in one sitting, or any, kind of other aspects of daily life you might want to comment on?
So absolutely. So I teach, I'm a teacher. So a good amount of my site, I'm looking at text,
Right.
Whether it's on paper or on a screen. So yeah, I'm, in the middle of my job, halfway through, and yeah, my eyes are tired regularly. So
Right.
So.
Yeah, and one last follow-up is just, have you noticed, or do you notice that, in work, do you have, good days, bad days? Is it pretty consistent? How long until your eyes do get tired, or how much of those light changes your eyes can kind of accommodate a little better or worse? Does it vary much from day to day, or is it pretty consistent?
It's pretty consistent. I now run kind of by the seasons.
Yeah.
Like I look, and of course with me teaching, it's a blessing now because, we're out for the summer. So I get a little bit of some, rest, but, seasons, I'm anticipating the fall season coming up and the dark season. So, So it's just constantly living, based on how much light is going to be, available. So.
Sure. Well, Andrea, thank you so much for sharing some of your experiences. Michael, did you have something you wanted to add or?
Yeah, thank you. First of all, thank you, Andrea. It's amazing, hearing all this from so many different people. The fatigue was a surprise to me, as I approached blindness, knowing that I had this and many others. That was not something that came up. And you do all the work. You think, okay, all right, well, I'm gonna learn how to orientate myself. I'll learn mobility, Braille, using assistive technology, amongst other things. But what you don't realize is how exhausting it is. And while our eyes might be tired, it's our whole body. And then what then happens from that is all the other things that come along with fatigue. And I can't overemphasize that enough to what a shocker that is, and that how each one of these little challenges that we're all noting forces us into kind of a darker place just because of that level of exhaustion. I find that even life's most simple tasks, I got to give myself a timeout and sit down and break. That was not something that ever came up. It was never necessarily a symptom, but it makes sense when you think about it. And if you're feeling that fatigue, it's very difficult to do all of the things that we're talking about doing. And it's interesting because not in any of the polling questions, fatigue wasn't an option.
Yeah.
There's always other.
Yeah.
But I think so. I'm really, really glad that Andrea brought that up because it's more than just your eyes getting tired. It's what happens to your whole all your physicality and for your soul, for that matter.
Right. And then I expect, and maybe you can share an example or speak to this, that more general fatigue, not just the eye fatigue, itself, impacts or limits what activities you're able to do or accomplish in daily life.
No question. I mean, and there's always these little things about, you want to have a little break. Okay, I participate in sports, in a variety of sports and at a very high level. But what I used to be able to do in terms of endurance and so forth, I find myself far more exhausted, sometimes even just getting to the start line of these things, and which obviously impacts the enjoyment of it. It's one thing to have to slow down and all of that. It's another thing to have to stop,
right?
All together. And that level of fatigue, it really does. Because these are the things that are supposed to give us enjoyment, give us a break. And you realize that with XLRP, there is no break. It is 24/7, even in your sleep. And I think that we forget. And something that also hasn't come up is we're talking about seasonality. We're talking about light adjustments. There's the AM PM challenges. For many years, I would, right around dusk, I would start to wake up, right when it's time to start going, getting ready for bed or whatever it was. I would start to wake up, and all of a sudden I'm like, well, wait a minute, I'm not tired. I'm actually ready to start my day.
Right.
And that's interesting because that was in fact lower light, and so I would be up all night until I was just so exhausted that I would just fall asleep.
Right.
And it was ironic because I couldn't see in the daytime until everything switched, where all of a sudden daylight became my friend and nighttime did not. And it, like I said earlier, it was very insidious and it happened very, very quickly. But now all of a sudden your sleep patterns are completely off. And anybody knows if you can't sleep,
right,
you're not good for anything.
Yeah. Well, I want to thank you, Michael, and thank you and Andrea for raising, the different elements of fatigue, but also sleep. I want to bring April into the conversation here too. Thinking about this, we're backing up a little bit, talking about impacts and the biggest impacts in daily life. What has that looked like for you, April?
Well, I'm speaking on behalf of my two children and my sister. They have the X-linked RP gene. I'm also truly diagnosed as well, but I'm on the very low end of the spectrum.
Sure.
So I always represent my family. But just like what Andrea was talking about, my son is now 22. He was diagnosed at 10. And my daughter's now 18 and she was diagnosed at 6. But my son has a lot of the eye fatigue that Andrea was just talking about and Michael was just talking about. And another thing too, at a young age, having difficulty adjusting from dark to light, the driving at night is a problem, but he still is blessed to drive during the day. Another big impact, and I think Michael and all these males that are supposed to be the breadwinner of the family can associate with this. He's 22 and he doesn't know what to do with his life. There's a sense of feeling inadequate because so much in life is depending on your vision and your eyes. And he's not a computer person. He's not a tech person. So he's not going to fall in that category. So he's now working for my husband and I at our granite business, but it's a big warehouse. We cut and make granite. So he's there, but we worry about his safety. So he's not working with the equipment. And then we try teaching him the office work. His eyes get fatigued. He's having to take breaks. So it's a big overall spectrum problem for everyone. It's a total life changing experience. And my sister, she was diagnosed at the age of 21 and she's 55 now. And the driving was her biggest impact. I think she went through a decade of depression trying to accept that. And now she's in that accepting stage. So I get it from, I mean, we're a whole big family like Lisa dealing with RP and so we support one another, but it's really, really hard. And it's hard as a mom. I'm not in any of Lisa, Michael, or Andrea's shoes having to deal with those impact one-on-one, but I'm a mom seeing it and you want to help and you can't help and you're there as a support system. So that's heartbreaking.
Yeah. Well, April, I want to, follow up and unpack some of the things that you said a little bit. One is you talked about, kind of, your son and kind of finding a identity in the workforce. And one thing that kind of stood out to me was, since he's, not maybe inclined to do paperwork or computer-based work, maybe more hands-on, but you were worried about his safety in the warehouse. Are there things that you had, observed, examples of things that you might be able to share where, his XLRP, would put him in danger or cause a safety risk? I assume that's kind of based off of some experience that you had with him and you of course would have seen as a mother. So can you maybe share a little bit there?
Yeah, I'll give you a perfect example. So we make kitchen countertops and I had him taking a sink out of my car and walking into the warehouse. Leaving outside in the light, and the warehouse has all these open bay doors, but still it's a dimly lit area compared to outside. So me as a normal seeing person can see up ahead that there's some crates on the floor. And I told him, I said, take this sink to my older son. My older son is not affected.
Okay.
Take it to him so he can cut the countertop. So anyways, he's walking with the sink. I could see this. My son starts to trip over these crates that are vividly seen. Almost broke the sink. His foot got stuck in the crate, but he's resilient and bounced back because he's 22 and agile. But I'm sitting there like, he's in the shop. We're giving him employment, but every day I fear that he's going to get hurt because it's a dangerous environment. But he jumps in and he's willing to work. He's a hard worker. So that alone is important because this disease can take a toll, like I said, on your ego and your ability and your confidence. It can really shatter your confidence. So as we're like his cheering corner and always trying to cheer him on, but it's very hard. So for those who have established a career as a lawyer, IT person, I give them much kudos because that is so difficult to even get yourself on that path. So that's what I'm dealing with right now, trying to make sure he can find a path in life for himself.
And if you're comfortable sharing about this, I did want to kind of ask about when that time came to kind of transition from the warehouse work to more in the office. How did that impact his confidence, his mood? Did you have any conversations about that? Because you've mentioned now that kind of self-identity, aspect, and how working is a big part of that. I think for any person, so again, to the degree that you are comfortable sharing, would be very interested to hear.
Oh yeah. Well, as a matter of fact, he was in the office yesterday helping me doing takeoffs and quotes. It's not his thing. He's not a very paper-oriented person, but I think he's realizing he's going to have to learn that aspect. And really, when you have a business, you need to learn how to run the office before you can even, run the outside portion. Yeah. So he was in there doing that, but he's also affected with ADD and a severe form of it. So trying to keep him focused. Besides having a visual impairment, I have him there trying to stay focused with ADD on top of it. But he's a great kid and he's very optimistic, but there's many, many challenges. And when he takes a break, like Andrea and Michael are talking about his eyes get super tired, and then it affects his whole physicality. So he's taking a break. And then my other crew members are like, why is he taking a break? They don't understand. Yeah. He has to take a break. So. Sure.
Well, April, thank you so much. We've got a phone caller and actually a lot of written comments that have come in. Maybe we'll start with some written comments, but first I just want to put out another pitch that if you would like to call in and share some of your experiences, either as a person living with XLRP or as a caregiver or family member of someone living with XLRP, you can dial in at 1-703-844-3231. And of course, you can continue writing in. We are getting quite a few written comments. So maybe first, Todd, let's check in, and what are you hearing about impacts on daily life?
Yeah, there were a couple that I wanted to call out at this point that really resonated with some of our panelists. Rod writes in to say, continual progression of blindness requires lots of ongoing adjustment to cope and perform. Losing one's driver's license takes away major independence of one's life, and not being able to read normal size print requires technology, which works, but takes time and training. Mm-hmm. Even though I have the apps and screen readers and know how to use them, reading snail mail and paying bills is not something I can do anymore. Technology is great and it helps with independence, but certainly doesn't compare to having vision. Another thing that he writes is taking disability meant leaving the workforce, taking a cut in pay, and ending up reversing the roles of me and my wife. She had to go to work to help us get by. Learning to give things up and accept it is a big part of having RP. Mm. And then I'd like to bring in another viewpoint of one of our other parents who writes in about her son. Kim writes in to say, my son was diagnosed at age 5. He is now 19, and although he tries to remain positive, the peripheral and night vision loss has certainly impacted both him and our family over the years. Things we take for granted on a daily basis: inability for your child to participate in his 5th grade dance because the lights were dimmed and he became frightened, embarrassed, and frozen in a corner because he could no longer see. Not being able to experience driving a car and get a driver's license while watching his younger brother accomplish those tasks.
Yeah. Some really good context to what we saw in the polling, the impact on driving coming out now in multiple different ways. I see we have a phone caller. We have Rod from Texas who wants to share some of his experiences living with XLRP. So we'd like to welcome Rod to the program. Are you with us, Rod?
I'm here. Can you hear me?
I can.
Okay. Yeah, that was actually my comment you just read here a minute ago. I was just going to highlight a couple of things, and one was when you were talking earlier, the two things that, I mean, in my years from 17 to 61, the two most things that stand out of being a problem were losing independence, and that was mostly from not being able to drive. So that was very much in the beginning.
Okay.
So just the the night blindness and the limited visual field.
Okay.
That's such a big adjustment. Losing one's license and not being able to drive and having to depend on other people and services and that kind of thing to get around. That's just huge.
Yes.
So the second thing I wanted to highlight, of course, I learned all the Zoom text and, all the different technologies to make things bigger, which worked for me for several years. My career went on. I got into computers, and that worked well for about 18 years. But then in my early 40s, it got to a point where making things bigger didn't work. So going from using technology to make things bigger to doing things audibly is that's as big as adjustment as not driving. And so that basically ended up being the part that forced me into disability, because it was such a big change that it didn't allow, I didn't have the time to get converted over and be able to get back to work, and the anxiety and all that occurred from it was unbearable for the most part. Heart attacks and, panic attacks, all that. So I can tell, I'm surprised I'm kind of nervous here, but yeah, I just wanted to point those two things out. Again, you read my thing there earlier, so I just wanted to kind of add to it.
Yeah, well, I mean, one, thank you for contributing in multiple ways, Rod. We encourage that. It's totally good to write in and call in, and multiple times. It's all, we want to hear as much input as possible. But Rod, you gave us a lot of context, kind of, historically, and some of the changes, and described how you're now on disability. So today, if you think about, daily life, of activities that are important to you, kind of now, what are the things that you struggle with kind of most, with all of the background you've given us kind of as context to where you are today?
I'm pretty fortunate in the fact that I have a wife that has sight. Yes. So my concern is if, someday when if that could change, I'm not saying we have a problem at all. I'm just, life, you never know who's going to be around one day to the next. And so the two things that a guy mentioned it earlier about snail mail. Mm-hmm. We get 90%, 99% junk mail in our mailboxes.
Right.
And, the real stuff we need, So me as a blind person and having to depend on scanning and, that kind of stuff to get through to find out what you need and what you don't need, that would be major panic, anxiety for me. I'd probably have to find somebody who'd be willing to come in and help me with that.
Sure.
And someone mentioned earlier cleaning the house. I mean, for the most part, I know where I'm at and can, do pretty well around here. But whether it's my wife setting something someplace or if it's me setting something someplace and then forgetting I put it there, I can turn a clean kitchen into a major mess in, seconds.
Right,
so
sure.
I can knock a glass of, something off onto the floor and it breaks. And, like I said, I can change the environment.
Sure.
In a big way real fast. So.
Yeah. The couple of things that you've mentioned I don't think we'd heard yet was certainly kind of, any of us forget that we just put something somewhere, but not being able to see it as the visual reminder, causing some trouble or havoc, as you kind of described it, but also just overall independence and relying on caregivers, but caregivers, right, worrying about your caregiving moving forward, and that's really important. So just want to thank you so much.
Well, can I point out the technology is great, but it's also constantly changing. So it's a challenge just to keep up with all of that. So.
Yeah. Well, thank you so much, Rod. I'm going to jump over here to Lisa before we go to our next caller. Sounds Lisa, like you want to add something to something maybe Rod had just spoken to.
And the vulnerability piece. As we lose our independence, we do become more vulnerable. And I don't mean that just like in a physical way, but in many other ways. For example, it's just been brought to my attention that my dad's being financially taken advantage of. And someone's using his credit cards again and again and again. And, you know, when you hand over that power, you have to be careful. Sometimes even in the hands of other family members, you become very vulnerable in lots of different ways. So that's not something that we've talked about. The other thing I wanted to mention is that you have to learn how to be a blind person. Yeah. That's much harder when you're born with vision and you're used to having it. My husband and I adopted a little girl who's blind from India. Mm-hmm. She has LCA. She came to us blind. Yeah. She's learning how to do all of these things that a lot of us who are losing our vision are trying to figure out. She's learning all those things at a younger age. She goes to a school for the blind. So we have to learn as we lose our vision to go to a school for the blind, to learn independence in a new way. Blindness is a new way of being in the world to us. Mm-hmm. But to her, that's all she knows. So it's really different, different experience. A lot of us who lose vision later on in life, we don't learn Braille. Yeah. You do learn Braille if you're born blind. Right. It's a very different setup. It's a very different experience. And the other thing I wanted to mention is there's a lot of people out there who think blind people can't do stuff. And that's not true. We just have to figure out, another way to do it. Right. So, and that takes time and it takes energy and it can be very frustrating. My daughter's trying to learn the assistive technology piece and she cried her way through a lot of the experience. She was so frustrated. And it's frustrating for me as the parent trying to figure that stuff out too. And it's not cheap. I just wanted to mention it's $225 per hour for the assistive technology support in our area currently. So the schools don't give sometimes the right support. We had to sue our school district because she couldn't get the support she needed. Sure. So, and time again, the schools don't understand what that young student who's losing their vision needs. Right. Well, they're clueless because it's 1% of the population that's blind. Yeah. Thank you, Lisa. Thanks for adding on some important kind of context there and kind of, even sharing, the differences between different forms of blindness and how that also changes the experience. I'd like to go to one of our phone callers. We have Paige from South Carolina, who's her loved one is affected with XLRP, and she'd want to share some of her the impacts that her loved one experiences. So, Paige, I'd like to welcome you to the program. Are you with us?
Hi, yes, I'm here.
Welcome.
Thank you very much. And I want to thank you for reading my fiance, Jeffrey, reading his comment earlier. I appreciate that. But yes, I wanted to call in to speak on his behalf, especially on this with that last polling with what has he not been able to do. And I selected school/work, and a lot of people have already spoken about this before. But he is a doctor. He is a DO. But in school, he was having a lot of difficulties. And I wanted to speak, this has been touched on a little bit, but on this particular thing with school and work, the bias and the stereotypes that he faced. And what's amazing to me, I've only known him for 14 months, but in hearing some of these stories and experiences, he's like, it just amazes to me that in the medical field, that profession, you would think they would be the most understanding and compassionate, but he was not able to complete residency because of his vision. Therefore, he is not board certified, and that has limited his job opportunities. Now, COVID was not a good thing by any stretch, but telemedicine has really emerged a big part because of COVID. It'll be around hopefully a long time, but that is what he does full time as an independent contractor. Mm-hmm. But he's very anxious a lot of times about the companies he works for. Are they going to view less? Are they going to view him less? Are they not going to allow him to do things? Are they going to keep him from doing stuff? And I hear about that a lot. So I just the computer has been tremendous for him being able to be a telemedicine doctor working from home 6 days a week. But someone else just mentioned how websites and technology gets constantly changing, and I will often just see where there's pop-ups and new things that companies and software move stuff around, and you can't see that very well. But the main point I wanted to mention was about the bias and stereotype and how that's affected him in school and work.
Sure, no, that's really important to hear about. Would you mind, Paige, telling us a little bit? You said he wasn't able to complete his residency. What aspects of his XLRP made that difficult, and maybe what aspects of the residency I guess did not weren't accomplishable because of those aspects of XLRP.
Well, and he's I've noticed he doesn't tell me too much. I just know this was an extremely painful time in his life, and sadly, I did not know him back then.
Oh.
But one thing I do know and can share is there were certain criteria, in being that he completed 1 year, and in that 1 year you have to do so many things and do certain rotations and like surgery, and I mean, he obviously was not going to go into surgery because of his vision, but they still held that requirement. And again, that's why I'm like, I can't understand how even in the medical profession, he was going down a route that was osteopathic manipulation medicine, OMM, which involves the use of hands. I mean, how perfect is that? And he has this incredible skill, but wasn't able to meet these other criteria that would have had nothing to do with the path he was going. And that a lot of things like that is what accumulated to him not completing.
Absolutely. Well, thank you so much, Paige, for sharing. I want to, before we move and expand the conversation one more time this morning, I want to check in on some of these written comments. Todd, anything in terms of health effects, activities in daily life that you'd like to share?
Yeah, a couple here really resonate. Wanted to go back to another contributor who's speaking about her son. She says, the RP's biggest impact on my son's life so far has been in physical education class in his elementary school. Whenever they play ball sports, he struggles significantly, and his classmates are too young to understand his difficulty seeing balls thrown at him. And here's an adult, affected adult who's writing in, and she says she's writing in from Lancaster, Pennsylvania. After 20 years as a PA master gardener, I am now giving up gardening because 1, sunlight is too bright, and 2, I can no longer distinguish between plants and weeds. As a grandmother, I cannot read to my grandchildren, admire what they want to show me, or even babysit without assistance. This is heartbreaking.
Wow. Yeah, so many diverse impacts. Really appreciate everybody sharing those. So we've heard a lot about what it is to live with XLRP, the different impacts, many different impacts it has in daily life. We've also started to hear a little bit about kind of worries for the future that you have living with XLRP. So for our final polling question of the morning, we want to ask you about that topic. So if you can go to that webpage that hopefully you've left up from earlier. If not, you can go ahead and open a web page on your computer, on your phone, your preferred device, and go to www.pollev.com/XLRP. What we'd like to ask you is, what worries you the most about you or your loved one's condition in the future? And again, we'd like some similar questions here. We'd like you to select the top 3 greatest worries that you have. The options are A, the stress of not knowing how XLRP will progress. B, the loss of independence. C, having to change jobs or stop working. D, family planning. E, not being able to care for your family. F, the impacts of relationships with family and friends. Or G, some other worry that you have that is you or your loved one, if you're a caregiver, that you have for them about their condition in the future. And again, please select the top 3. So we'll give you a few more moments here to think about your top 3 greatest worries for your future or your loved one's future living with XLRP. So far, it looks like kind of neck and neck towards the top is the loss of independence, and which is B, or A, the stress of not knowing how XLRP will progress. We are seeing responses, several responses across each of these categories, however. So each of these are in several or many people's top 3 greatest worries for the future. And we even see some other worries. And so we'd love to hear from you all about these worries, what's driving this concern, based off of where you or your loved one is in their XLRP journey. So I want to thank you for answering this polling question. And I'd like to actually first go to a phone caller that we have to bring in to this discussion, both, of course, continuing to gather experiences of living with XLRP, but now adding, the kind of this topic of worries for the future. We have Alan from Phoenix, who is both self-affected as well as has family members affected, and wants to talk about certain aspects of that experience. So Alan, I'd like to welcome you to the program. Are you with us?
Yes, thank you.
Yeah, welcome.
So I just wanted to go back to a previous poll.
Yes.
And expand on the depression aspect of it, and sort of like hitting the wall and becoming legally blind. So I'm a physical therapist, and I was working in West Palm Beach, Florida. And in 2018, I moved to Phoenix, Arizona. And I've never had problems getting work before. So I was applying for jobs and went on 5 interviews. But what happened was I kind of hit the wall and became legally blind. And so I was bumping into things, so I was being very careful during the interviews, and then I wasn't hired. So I went from working to not working, and so I kind of hit the wall where I was legally blind without any skills, and became very depressed and started taking depression medication. And that's what I wanted to add to the conversation.
Sure. And so, if you don't mind me asking, was this, kind of the first time that you had experienced, depression or similar feelings, or was it really, for the first time triggered by, this difficulty or inability to get a job?
Yeah, it was, the depression was related to not being legally blind, because, it's a slow progression, and then eventually you kind of hit the wall where you're just not able to function anymore. So I hit that wall, and then I wasn't working. So, the loss of the job, loss of the breadwinner, and then so it all kind of came down on me, and the depression hit really hard.
Sure. Over time since, first experiencing that depression, how has your experience with the depression been? Has it, gotten better or maybe worse over time? If you don't mind speaking a little bit to that as well.
Oh, sure. Yeah. So, I applied for vocational rehab and disability. So that started to help. And then I received training through Foundation for Blind Children Adult Services Transition Program here in Phoenix. And then, mobility and computer skills. And so I transitioned to IT, working with Blind Institute of Technology and Salesforce training program.
Sure. Well, thank you.
And so, it made everything better. Got back to work.
Oh, that's great to hear. Well, I really appreciate you talking about this. I know sometimes the mental health aspects are, a little trickier to talk about. They're not talked about enough. And so, Alan, really thank you for kind of sharing so much about your experience there. I want to circle back to, with the time we have remaining, this topic of worries for the future. And I want to circle back to you, Andrea, here. As you were thinking about that polling question, or just more generally as you think about the future of living with XLRP, are there any worries, concerns, fears, that are top of mind for you?
So the biggest worry that I have is I'm a mom of 2 daughters, and just them and how they're impacted. So like right now I'm living a life where I'm just kind of getting them. I have a 13-year-old daughter and an 8-year-old daughter. And so getting them prepared for the future and, and things like that. So, they're at the age where I'm trying to get them in extracurricular activities, regularly, and, and just advocating for them in school and grades and things like that. So, and just also them, getting them tested to see if they, have it as well. So those are the biggest things. So my future right now is just really just on them and just making sure, about them. So.
Yeah. Andrea, are you at all worried that, even with the degree of impacts from XLRP that you have now as your children get older and are wanting to do more or different types of things, that you're not going to be able to kind of help them or enable them to do that? Or is it you're worried that, your vision will worsen in some way, and that will be the reason you can't, help them or they'll be able to participate in those activities?
Yeah, so my biggest fear is that I will hinder them from, being able to, be, successful in, their development, and such, and their desires and things like that, and, and growing into healthy young ladies. So.
Yeah. Well, Andrea, thank you so much for sharing that and helping us understand some of your concerns looking forward. Just to kind of go around the horn here, and we did, unfortunately, April had to drop off to do something for her child, but we'll go around the kind of Zoom table here. Michael, on this same topic of worries for the future, what stands out as a top worry or concern for you?
It's funny because how dynamic all of this is. Like if you were to ask me this question 5 years ago, 4 years ago, 3 years ago, and then now, is definitely my health, and obviously my ability to take care of myself and any dependence is rather huge. It isn't easy. Now it all comes obviously back to transportation amongst other things. I live here in Colorado, and anybody who watched the news back in January, actually the town I live in was devastated by fires, and many of my friends lost their homes. But if that was my situation and it was dangerously close to it being me, and living in an area where that just one doesn't expect that to happen, that would have been it. I wouldn't have been able to navigate that. Nobody would have been able to come and take it. And of course I would have been dependent on somebody actually coming and rescuing us, myself, and I have to say that it's probably the highest on my list. I've had some recent health concerns that I believe are a direct effect of the stress that comes along with my sight loss. But I'd have to say that would probably be high on the list if I'm 53 years old now, and things change naturally, and but realizing how limited I am, doctor appointments change. I can't move that fast to do it. If I absolutely need something in terms of emergency medicine, amongst all of those things, I'd have to say I'm pretty terrified of that. So while that's my present, I can't see how that's going to get better.
Right. No, that makes a lot of sense. Thank you so much, Michael.
Sure.
And Lisa, I want to get your perspectives on worries and concerns. What is your top worry or concern for the future?
Sure. I'm a caregiver for my dad, who's 81 and blind with X-linked RP. I'm a caregiver for my daughter, who's totally blind and 15 years old with LCA, and I'm losing my vision, right?
Yeah.
So my concern is, how am I going to continue to care for everybody? And the pressure on my husband. My dad, when he got hit by a car last month, my husband had to step up, get him to the hospital. It was in the evening, and take care of that. It's a lot on him. There's so much pressure that's happening, for him. So that's one of my concerns. My other concern is a lot of people who lose all of their vision have a hard time sleeping at night. They have 24-hour sleep disorder. That's a super challenge. If you can't sleep, it makes everything harder during the day.
Mm-hmm.
So my daughter, I make sure she exercises at least 10,000 steps a day in order to get her sleeping,
Right.
because that's going to affect functioning, right? If I don't sleep well, my vision's bad the next day.
Right.
So I think a lot of people who are blind have to take sleep medication. And so it gets challenging on so many different levels. But if I get injured, if I'm the one that gets hit by a car, how do I care for everybody? They'll have to care for me, and I'll be a further burden, especially to my husband. So I don't want to be a burden. I think that's one of my biggest concerns. My dad went blind when I was 3, so I started taking care of him when I was like 4. I mean, my mom left, and that's pretty common too. The spouse will often leave when the other spouse goes blind.
Right.
So, and I don't think that my husband will leave me, but it definitely is a bit of a concern, because I have seen that. I have a master's in counseling, and so I counsel families that are experiencing vision loss.
Yeah.
And so the other thing that worries me is my dad's drinking. The isolation, often in this population that's felt, can easily lead to drinking and depression. So I think those go hand in hand. And that's not something we've talked about too much on the call,
Right.
but it is pretty common in the population.
Yeah. No, that makes a lot of sense as well, Lisa, and a lot of, it's kind of the concerns about, direct concerns of kind of progression, if you will, but we're hearing lots of other concerns of, just even with kind of current degrees of visual impairment, something.
It's complicated, James.
Yeah, something else is coming, could come along and complicate things too. I guess, the getting hit by a car being a pretty, big example of that, which I'd like to say is a pretty extreme example, but also from what I've heard, it sounds like it's not all that uncommon. So I don't want to characterize it that way, unfortunately.
A lot of people have their canes run over. That's another thing I've heard, by cars. So that's not far from hitting them.
Yep.
A lot of people don't know what a cane is for, especially people from other countries. They don't use canes in other countries typically.
I see.
So when someone sees a cane, they don't necessarily know that person can't see.
Right. Well, thank you so much to our Zoom panel. I want to give the final word to those that have been writing in. I will preface that we get a lot of comments, and that's a great thing. All of these comments will be incorporated into the Voice of the Patient summary report. So if you haven't heard your comment shared here this morning, it doesn't mean we didn't get it or that it's not important. But with that being said, I'll turn it over to Todd to share some of what we heard about worries and concerns from our written comments.
Right. There are so many great comments to call out, but I wanted to pick this one because it's really going to transition us into the afternoon. Here's writing from, this is from a parent in Virginia, and she says, "On my worst days, I'm consumed with worry. Will a treatment be approved in time to help my son? Will we be able to find a clinical trial accepting new pediatric patients? I'm terrified he will lose his vision before a treatment is available, and then it will be too late." And she further goes on to write to say, "I feel like I'm in a car crash and I can't swerve out of the way. I can't stop it. I can only watch it happen helplessly."
Wow. Very impactful. And yes, a good transition to the afternoon where now that we've learned so much about what everybody in our audience lives with on a daily basis with XLRP, we're going to kind of expand into a different area and understand your experiences with different treatment approaches. And as we'll describe in the afternoon, we're going to talk about a lot of different things, including what many people have already started talking about, which are different accommodations that you make to live with XLRP. So we'll explore all of that and the treatment approaches, both current as well as your thoughts about future treatments in the afternoon. For now, we're going to take a 30-minute break. We will resume at 1 p.m. Eastern Time on that topic of treatments. So thank you all for your input this morning, and we look forward to continuing it here after a brief 30-minute break. Hi, and welcome back to the externally led patient-focused drug development meeting on XLRP. My name is James Valentine. I'm here with Todd Durham from the Foundation Fighting Blindness, and we are excited to get back into this program and get into that second topic for the day, which is really to explore the approaches to treatment. And when we go into these approaches for treatment, what we're really talking about is not just medical treatments or medicines, but we want to understand from all of you the different approaches that you take to making living with XLRP a little easier, including assistive devices, different accommodations that you make in your life, and understand how those things help, maybe don't help, and some of the downsides to help us understand some of the topics that we'll be exploring in this afternoon session. We will, if we can pull up our discussion questions for session 2. So this is just to get you all thinking in our audience, all of those of you living with XLRP or caregivers and family members, start thinking about these topics because we're going to want to hear and get your input on each of these. So to start, we want to understand what you are currently doing to manage your or your loved one's XLRP symptoms. So again, the things that you might be doing include medications, other medical type treatments, including using medical device interventions, but also assistive technologies and devices, as well as, again, those different accommodations or even different lifestyle modifications that you might make. What is in your arsenal, what is part of your regimen as you try to manage your XLRP. Once we, as we're understanding what you're doing, we want to understand how well those different approaches are actually addressing the most significant symptoms and health effects of XLRP. What is helping? Maybe there's some uncertainty about whether some of the things you're doing help. Or maybe there's some things you're certain aren't helping or addressing the XLRP symptoms and impacts. In addition to understanding kind of how well the different approaches work, we want to understand if those approaches come with downsides. So what are the most significant downsides to you or your loved one's current treatments, and how do they affect daily life? This could be anything from side effects of drugs or certain devices. This could be the burden of undertaking a certain treatment approach. Whatever you view as a downside, we'd be interested in hearing that. And then once we've kind of fully explored, the current approaches to treatment that you have available, we're going to shift and think about the future. And we're going to ask you, short of a complete cure, what specific things would you look for in an ideal future treatment for XLRP? We'll also be wanting to know, if you were to be considering a new treatment for XLRP, what factors would be important to you in deciding whether to use that treatment? So we'll be exploring that, all of these topics within the afternoon together. But to get us started in discussing treatment approaches, we have another panel who will be sharing some of their thoughts on these topics. We have Richard, Paul, Robert, and Daryl. So Richard, why don't you take it away?
Hello. My name is Lute, and I'm a black Labrador Retriever guide dog. Richard and I have been working together for over 4 years now. He walks me outside 5 times a day and feeds me 4 times a day. We go for long walks almost every day, and it's my job to keep him safe, watching for cracks, bumps, hanging limbs, avoiding distractions, and oncoming cars if we're on a road and not a sidewalk. Ouch! Quit stepping on my paws, Dad. Yes, unfortunately, Dad has a vision problem. I heard the doctor say he has an eye disease called XLRP. I think that means extra large vision problems. Dad does not drive a car anymore. He drives me instead, his black Cadillac. When it's time to go outside, he reaches out to find me so I can walk beside him with my harness and leash on. Denver Airport is one of our biggest challenges. When we go by ourselves on a trip, we navigate together through a lot of people to find our departure gate. Dad holds on to my handle and leash as we slip in and out through the crowds, with him asking, "Is this gate 32? When we fly back to Denver, I find the escalator from the gate area down to the train. He'll say, "Hop up," and I move with him onto the escalator, and down we go. We follow the crowd onto the next train, and off it goes to baggage claim. Everybody is in a rush to get off, go up the escalator, get their bags, and go home. We just go with the flow. When we get to baggage claim, Dad says, "Loot, find the bag." I sniff and sniff as the bags whiz by, turning my head back and forth. If anyone is watching, I bet they think I'm looking for our bag. But I'm actually sniffing for it. My food is in there. When I smell my food, I turn and signal, "This is it." I went with Dad to the eye doctor's office and saw a woman put lots of drops in his eyes. He had to press his face against a glass with lots of bright lights flashing. Dad tried to read a lot of letters on a screen, and then the woman said 2,600. He got lots of cream put in his eyes and a wand rubbed round and round, and after that he had needles poked into one of his eyes many times over the next year. But it didn't seem to help his vision. The stem cells didn't work, I heard him say. So he still needs me, which is a very good thing because I love him very much. Dad has a lot of devices which help him in his work and to communicate with people. Lots of people. He uses JAWS on his computer. But I thought that was a movie about a shark. JAWS reads what's on his computer screen to him. Dad wears an iPhone on his belt that also talks to him all the time. It tells him who's calling, if he has a new text message or email, and when his appointments and meetings are. What a noisy hip. Gosh, I wish this gene therapy could help Dad. That way he could watch more television and actually see what's going on rather than just seeing shapes and hearing lots of voices and music. Recently, Dad was saying how he had used a white cane for 15 years to find his way around, going to the eye doctor at least every other year for checkups. But now that he's working with a great guide dog, that would be me, his life is much easier. Dad says, if I could see enough for good orientation and mobility, then when Lute and I are walking around town, maybe we could see the large store signs to know where we are. Now I use a GPS app that tells me where I am, but it would be nice to be able to confirm that with a little vision. Dad says he knows there are risks with a new treatment, but without a risk, there could not be any vision gained. He got some edema from the stem cell trial, but only had 2,400 vision then, and the risk was worth the investment of 2 years flying back and forth to the trial site. Even if Dad does get some of his sight back, I know we'll always be together because we're bonded for life. That's how we guide dogs roll.
I'm Paul Martz, 59, from Erie, Colorado. I was diagnosed with RP in 1976 when I was 13 years old. Now that I've lost my central vision, I consider myself blind. Want to know how it looks? It's a lot like watching an old black and white television tuned to a channel with a weak signal. Everything is flickering static, gray, and indistinct. I see something, but I almost never know what I'm looking at. The biggest way this impacts my life, I can't read. Back when my central vision was intact, I could read large print. I could use magnification on my computer to blow up the size of the text. I had a CCTV, which is a camera and screen system that turns normal print into large, high-contrast text. But as my central vision got worse, those options stopped working for me. I'm reading this presentation using screen reading software on my computer. A computer voice reads each line, and I hear it in my earbud, and then I repeat back what I hear out loud. If you're curious about my glasses, no, they don't help me see. I'm blind. But they do protect my eyes. And since I've worn them all my life, I figure, why stop now? Print material, though, is everywhere. I depend on my wife to read most print material, and when she's not around, I use text-to-speech apps like Seeing AI. It's a great app. You just point your smartphone and it reads the text. It reads printed letters and addresses on envelopes. It's invaluable, but there's still situations where I struggle. Suppose I want to cook something out of a box. The directions are right there on the box. Any sighted person can see it at a glance. You won't get confused by the nutrition information or the barcode or the marketing hype that tells you how yummy it is. Now try reading it with a text-to-speech app. It reads everything it sees. It runs lines from different blocks of text together. What am I supposed to do with that? Why aren't the apps smart enough to sort out the blocks of text? It's even more of a challenge when the text is on a plastic bag or something round like a bottle or can. Then there's the dreaded software update. It's guaranteed to change the app layout like somebody rearranged the furniture. These are amazing apps and they help in a lot of situations, but they're no substitute for good central vision. I have a 7-year-old grandson and I'd love to read aloud to him, but without central vision, I can't read print, not even large print books. Lots of children's books are available in Braille, and Braille is freaking cool. But I learned it as an adult, which means I read really slow, way too slow for my grandson. Or I could do what I'm doing right now, move through text on a computer, and I could read back what I hear the screen reader say. But the story would have to be something that's online. Basically, without central vision, I have no good options for reading to my grandson. Besides reading, any graphical information is inaccessible to me. Take the recent COVID outbreak. Many health websites presented COVID data as graphical charts that I couldn't see. It was bad for me mentally. I wanted to know, was the situation in my county getting better or worse? It made me feel like we've got this global pandemic going on, but we're not going to tell the blind people how bad it's getting. Of course, it wasn't personal. It's just a natural way to present the data. But it took a lot of effort for me to contact website developers and convince them to put COVID numbers in a table so I could read it with my screen reader. I know it sounds like I'm complaining, but I'm not. These are great tools, and I'm a technology nut, so I love this stuff. I just want you to know, all this blind technology, as great as it is, it's no substitute for good central vision. Nothing beats good central vision. If I had lost only my peripheral vision, I'd spend the rest of my life as someone with a vision impairment, and that would stink. But it would still be better than losing my central vision and leaving me blind, which is where I am now. So if there's one treatment the RP community needs, it's restoration of central vision. Even preserving remaining vision would help so many who still have their central vision intact.
Good afternoon. My name is Lisa Pollock, and I'm reading from my husband, Bob Pollock. Hi, I'm Bob Pollock. I took this photo while visiting the Oregon coast in 1988. Later that year, I was diagnosed with retinitis pigmentosa. I was going blind. I believe education and experience are the best tools for overcoming fear. So, immediately after my diagnosis, I learned everything possible about RP. Tennessee's Vocational Rehabilitation, VOC Rehab, office provided me with financial assistance and wet cane training so that I could attend college and earn my bachelor's degree in management. Believing I needed to be more competitively employable because of my failing eyesight, I got grants and student loans and earned my MBA from Thunderbird, rated the #1 international management school in the world. While in school, I joined the National Federation of the Blind, NFB, registered with the Foundation Fighting Blindness, and studied remotely with the Hadley School for the Blind. I learned all I could about my family's history with RP. Unlike my relatives, I was driven to treat RP as one of life's annoyances. My mother's uncles had RP, and they chose to let the disease consume their personalities along with their eyesight. They treated RP by burying their heads in the sand, refusing to act on it. Ever since my diagnosis 34 years ago, I've been taking a daily regimen of vitamins and minerals believed to help slow RP's impact on remaining eyesight. Though considered a homeopathic treatment, this combination includes FFB and doctor-recommended vitamin A palmitate. My eyesight has lasted 20 years longer than my great uncle's. I believe these supplements are solely responsible for slowing my RP's deterioration. For some years now, I've been in the FFB's Retina Tracker database. From it and the FFB's expansive connections to retinal specialists and researchers, I've participated in a handful of online surveys and information gathering studies, but clinical trials and in-depth studies still evade me. My wife and I were determined to prevent passing RP along to our future children. Realizing that scientific progress regarding genetic treatments and cures was still decades away, we took matters into our own hands. We adopted all of our children. We can state without any doubt that my family's version of retinitis pigmentosa will die with me. Adoption can't truly prevent the disease from being within the genetic makeup of our children, but adopting did effectively eliminate any chance of RP being passed from me to our children. Recent FFB-sponsored genetic testing confirmed my RP is X-linked, XLRP, meaning that XLRP can't be passed along on the male Y chromosome. My remaining eyesight went downhill rapidly in my 50s and hasn't yet leveled off. These days I only see shadows, no color, no depth perception, no clarity, nor detail, only blobs of dark, a medium gray, and very light tan. RP also devastated my career and my self-worth. Thankfully, though, Social Security's disability payments, SSDI, enabled me to maintain a minimal lifestyle for my family. RP took its toll on me physically and mentally. I gained 90 pounds and am now taking medications to treat anxiety, depression, diabetes, high blood pressure, and high cholesterol. As a result of seeing a psychiatrist and taking the prescribed medicines, I'm exercising, eating healthier, and maintaining a better attitude these days. As therapy, I've been writing and publishing novels and short stories online. Woodworking, specifically turning bowls and plates, has been a productive therapy for me as well. Helping to rebuild my self-esteem, I remain my family's handyman. I can repair or replace everything in our home. I don't even bother to rely upon my remaining eyesight much. Most times I close my eyes so I can concentrate better. My tiny bit of eyesight is more of a hindrance than a help. Currently, I'm in training to become a vendor through Tennessee's Business Enterprise Program, TBE. This is possible due to the Randolph-Shepard Act of 1936, which grants blind vendors the exclusive right to operate vending machines on federal, state, and other properties. Offered by Voc Rehab, I'll have a route of vending machines to stock and service. I believe this will allow me to earn a respectable income once again. I do enjoy working with products created to put smiles on my customers' faces. My computer experience goes back 40 years, and my career has always been computer dependent. RP took its toll on my ability to use my management software tools. I adapted by learning screen reading programs such as JAWS, Job Access with Speech, ZoomText, and Apple's VoiceOver. My first and only smartphone remains the Apple iPhone. Its VoiceOver software and mobility apps help me navigate, shop, and find things I misplace. Sure, I haven't directly benefited from scientific advances, gene therapies, clinical trials, or studies. I do believe I've successfully mitigated many of RP's effects, reducing it to nothing more than a constant aggravation. Through education and training, RP has not disabled me. Thank you.
Hi, I'm Daryl Adams, and I am the Director of Accessibility at Intel. In my role, I oversee the global accessibility strategy, which is designed to ensure Intel offers an inclusive, accessible workplace for all employees, and that we embrace inclusive research and design practices to help create a future where technology and access to digital information is inclusive and accessible to everyone. Throughout my career, I've worked on numerous assistive technology solutions, including an electronic reader, a spatial awareness wearable, and enhanced indoor wayfinding to assist people who are blind or visually impaired. While I was diagnosed with XLRP when I was 14, my interest in assistive technology really began about 20 years ago when I began experiencing incompatibilities with my work environment due to my progressive sight loss. I began learning about various technologies such as screen readers and screen magnification that were available to help me continue doing my job. But not long after my introduction to assistive technology, I made a commitment to making the creation of accessible technologies a cornerstone of my career. Considering the impact that progressive sight loss has had on my life, I think it's important to distinguish between blindness and visual impairment. People who are blind do not rely on eyesight, and instead develop skills and techniques to help themselves navigate a world that is largely designed for sighted people. While people who are experiencing visual impairment tend to rely on their eyesight, which in the case of degenerative eye disease becomes increasingly unreliable over time. I've led an active life, and I played soccer as a child, and as my eyesight began to get worse, I gravitated towards sports that focused more on individual achievement, such as skiing, running, and cycling. As my sight loss progressed, I was faced with a decision. I would need to stop participating in the activities that I loved, or I would need to find alternative ways to participate. And for me, the answer was finding sighted guides to help me keep going. While I found success in my pursuit to stay active, it does remain a pretty significant challenge as my needs continue to evolve over time. Finding ways to stop my sight loss progression would mean the world to me. The slow journey into sight loss presents a series of physical and emotional challenges. Learning how to effectively use a white cane and travel with confidence is a daunting task on its own. And summoning the courage to begin using a cane in public for the first time is much more difficult than it may seem. Beyond the practicality of the white cane as a tool, it also represents a notable shift in identity. And I think a lot of people who grow into sight loss struggle with this transition. Living with XLRP, I feel like I've never an expert in dealing with my evolving set of needs. It is a feeling of not knowing what the future holds that I feel is the most difficult aspect of the disease. Living with XLRP is a lifelong series of adjustments and continuous learning and adaptations, but never mastery. So while it's important to embrace new tools and techniques to manage living with sight loss progression, having actual treatments available would fundamentally change the lives of so many. A treatment like gene therapy that may have the potential to stop the disease progression will effectively ease the way for those who are in the earlier stages of decline, and will allow them to plan for a life where they can rely on their eyesight. Even if it's not perfect, stopping disease progression is a big deal. For those of us with later stage disease, it's more relevant to look toward treatments like stem cell therapies, optogenetics, or potential retinal implants to both preserve and restore usable levels of vision. While people do continue to lead productive lives without the benefit of sight, it's hard to underestimate the value of vision for those who have experienced a lifetime of eyesight and value the visual world around us. I feel the pursuit of treatments protocols for XLRP is essential to give people living with this disease a sense of optimism for the future. I've participated in natural history and visual field measurement studies, and I was recently a control participant in a gene therapy clinical trial. I strongly believe that consistent scientific advancement in this field is essential to making progress in the pursuit of sight restoration, and I'm excited to have the chance to participate in the science that promises to restore eyesight and improve the lives of so many. When I was first diagnosed with XLRP, there was no known cure, and there was little understood about the cause of the disease. I was told that it was unlikely for that to change in my lifetime. But since then, many gene mutations have actually been identified, and so much information about the functions of these genes is now understood. My retinal specialist can now explain to me specifically what is causing my eyesight loss, and the treatments are progressing. It now feels more likely than ever that I will live to see the benefits and the extent that this extensive research and scientific advancements taking place in pursuit of a cure for blindness. Thank you.
Thank you, Daryl, and to all of our panelists in this afternoon's panel discussion here, really exploring such a range of different treatment approaches, and again, treatment approaches being everything from drugs to dietary supplements to clinical trials, assistive devices, and I heard a number of different words, probably all kind of referring to the same sets of things: accommodations, adjustments, adaptations. These are the different approaches that we want to explore and hear from all of you in our live audience now, as we have this second opportunity today to have you all call in, write in, share your experiences. If you'd like to call in and share some of your treatment experiences, you can do so at 1-703-844-3231. Again, that's 1-703-844-3231. Again, just like the morning session, at any point, if you'd like to weigh in on one of the topics we're discussing, we would love for you to call in. We'll get you into the live program and have a little bit of a dialogue about your experiences with different treatments, and towards the end of the session, what you're looking for in future treatments. But to get us thinking about these different approaches to treatment, we're going to go to some polling questions that'll give us a sense of what you all have tried and how well it's working. So if you can go ahead and open up that browser or new tab on your browser, on your computer or on your phone, whatever your preferred device, and go to www.pollev.com/XLRP. Again, that's www.pollev.com/XLRP. Keep this page up for the rest of this afternoon session. We'll be periodically going to some new polling questions. So our first question for you this afternoon is: what medications or medical treatments have you or your loved one used, either currently or previously, to treat symptoms associated with XLRP? And please select all that apply. We will be separately asking about some kind of more of the accommodations and other strategies outside of medications and medical treatments in a future polling question. So here we're really focused on medications and medical treatments, and the options that you have are A, vitamin A, B, Argus 2, C, cannabidiol or CBD, D, medications to treat or to manage anxiety or depression, E, some investigational therapy, whether an investigational drug, cell, or gene therapy in a clinical trial, F, other medications or supplements not listed on this in the response options here, or G, if you have not used any treatments recently, so no medications or medical treatments, the types of things that are listed in the other response options. And we know that these things, strategies change over time, so as you're thinking about it here, we kind of want to know anything that you've tried at any point, but we would, of course, when you call in or write in, like to hear about what you're using now, how your treatment regimen maybe has changed over time, what informed your treatment decisions. What made you start? What made you, if you started something and are no longer using it, what made you stop? We would very much be interested in exploring each of these and understanding how each of these things fit into the overall approaches to treating the symptoms of XLRP. So while any final responses come in, what we're seeing is that, and again, these are as a reminder for this afternoon session, whenever we have responses that allow our audience to select more than one, we're seeing a percentage of the total responses, so not a percentage of the individuals selecting any one option. So you can view these bars as a type of ranking, and I will also talk through these results for everybody. So the top, most common treatment approach in our audience today is vitamin A. Kind of a little bit of a drop off from that. We see a clustering of investigational therapies and clinical trials, as well as other medications and supplements that weren't listed in these response options. So very interested to hear what what those are, what these investigational treatments were, what these other medications are that we haven't had listed. We see then we have some experience with medications for anxiety and depression. We heard a great deal about particularly depression, as well as a bit about anxiety in our morning session. So we see that there is treatment for those kind of aspects of living with XLRP. And then we see everything else, of course, also selected here. So even some less commonly employed treatment approaches, we want to hear about those as well, not just the most common. And I should note that we do have individuals reporting that they're not using any of these medications or medical treatments. And we want to hear from you as well. What has informed your decision? Perhaps it has to do with where you are in your XLRP journey. Maybe it has to do with some of the specific characteristics of some of these treatments. And so you've made some personal decisions. So very much want to hear from you all as well. So we can go to our second polling question. And as promised, here we're exploring approaches besides medications and kind of medical treatments. What either currently or previously have you or your loved one used to help manage the symptoms of XLRP? And again, you can select all that apply. The options are A, service dog, B, magnifying device for computer, C, device or software to facilitate audio reading from your computer or other device, D, closed circuit television, E, lenses to magnify central vision, F, portable lighting devices, G, a low vision specialist, H, school or workplace modifications, I, use of UV sunglasses, J, cataract surgery, K, retinal prosthesis, which is artificial retina, L, behavioral or psychotherapy, or M, some other, again, assistive device, accommodation, adjustment, adaptation, whatever it may be, that is not already listed as one of these response options. You can select M, which is other, or N, you are currently not doing anything, any of these types of approaches to try to help manage living with XLRP. So I know there's a lot there. Despite what you may kind of coming in and you heard the word treatment and said, oh, well, we don't really have treatments for XLRP. We do know that there are lots of these different types of, management strategies, if you will. And so we want to hear about those, which aspects of XLRP do you use these for, to try to help manage and live with? Again, how well do they work? And what are the downsides? So what we see on the slide is that there are quite a few, a lot of these things are employed by a lot of people. To highlight a few things that stand out, portable lighting devices, magnifying devices for computers, and then maybe number 3 is use of UV sunglasses are some of the most commonly employed treatment approaches. We see device software to facilitate audio reading, low vision specialists, school work modifications, as well as lenses to magnify central vision and cataract surgery, all those other fairly common experiences. Everything else, there's a little bit of a drop off to some of the others, but again, everything here is being employed by a number of our participants today. So while service dog may be the lowest of those, we've already heard one panelist describe, we heard the service dog describe her experience with helping care for her loved one. But we still want to hear about how that's working or decisions to employ a service dog. And then I will note that we do have a number of people who are not, again, currently not doing anything. We still want to hear from you during this session and just understand where you are in your journey and what is the reasons for not currently, trying using any of these approaches to manage symptoms. All right, so we have one more polling question for you at this point. It's kind of to tie it all together. If we can move to polling question number 3. So thinking about all of those things, the medical approaches, the non-medical approaches, how well does that together, that current treatment regimen, how well does that aid with the symptoms and control you or your loved one's XLRP overall? So kind of what's your global assessment of how well these things are helping with the symptoms and controlling the condition overall? The options are A, not at all, B, very little, C, somewhat, D, to a great extent, or E, not applicable because you're not using anything. So think about this. This is a really important one to think about the why. Why am I picking? What's coming to mind? What aspects aren't controlled? That's making me pick this. What things are? Does the current treatment regimen actually help with? And how is that informing my decision? And then please call in and write in because we want to hear about that, and we'll be exploring that via phone and written comments here very shortly. Okay, so with any final responses trickling in, so far the response with the greatest proportion selected is that the current treatment regimen aids somewhat with symptoms and control of the condition overall, and that's just under 60% of our respondents selecting somewhat. We see that just under 20% report very little, and then we seeing just over 5% both saying either that these things help not at all or to a great extent. And then again, consistent with our other two polling questions, we do have a number of people who are selecting that they're not using anything. So this particular question is not applicable. So again, we want to hear, the majority of you, the somewhat, what does that mean? Some things are helping, some things aren't, or the things that they're helping, they're just not helping enough. Please let us know so we can really kind of get a good lay of the land and understand, again, these current treatment approaches. So I'd now like to welcome our Zoom panel, who will be, like our morning panel, helping us explore a number of these topics and getting us started. Before we jump in with the Zoom panel, though, I will remind everyone that if you would like to weigh in on some of those treatment approaches we just displayed and had you vote on in the polling questions, you can call in at 1-703-844-3231. Again, 1-703-844-3231. It's your opportunity to have your voice heard. Tell us about some of the things that you've tried. But to get us started, I want to maybe focus first on things that have helped the most. We had a range of responses in polling that indicated that some of these current strategies are helping at least somewhat for the majority of people. So maybe we can start with John. As you were kind of considering or hearing us talk through those different treatment approaches, what stands out to you as being most helpful?
Yeah, so hello everyone. My name's John Erickson. I live just outside Minneapolis and lead the cloud security efforts at General Mills. For me, it's principally about accommodations that, from an end stage RP perspective, I was one of those somewhat people, so you grab on to whatever you can to help, get access to the information you need and make things accessible. And for me, a lot of magnification, screen readers and things of that sort. So that's where I've principally benefited.
Yeah, no, that's really helpful, John. And maybe some of those kind of approaches, screen readers, magnification. Can you help us maybe understand what those tools allow you to do that maybe you wouldn't be able to do without those?
Yeah, I mean, just every day at work, to be able to blow things up. Earlier, some panelists sort of went into that dichotomy of where we're somewhat in this visual world, and we at some point have to transition to more audio, and that's just a fuzzy line, and so I think a lot of us find ourselves straddling, having to rely on vision to accomplish work, daily life, etc., and needing to pivot somewhat with different skills and technologies to facilitate that.
Yeah, and would you say that those technologies and strategies have helped you with, you mentioned at the outset your position and your career. Has that been, how has that played a role in your job and work life?
Yeah, I mean, again, in the somewhat category, and it's certainly not ideal, but I consider myself an effective employee, and there are other areas where we have to, rely on others and different ways to solve problems.
Sure.
So.
Yeah, well, thank you so much, John. Mark, I want to bring you into this conversation of starting again with things that maybe have helped the most, whether medical treatment, clinical trial, assistive device, or accommodation, all falling within this bucket of treatment approaches. What stands out to you as maybe things that have worked best for you?
Okay, thanks. My name is Mark Curley. I'm 48 years old. I live in Atlanta, Georgia, and I've been diagnosed with XLRP for well over 35 years. I'm currently participating in a clinical trial. It's a gene therapy clinical trial where they treated just my left eye only. And I'm coming up on my 3-year checkup at the end of this month, and the goal of the trial and the treatment is to halt any further progression of the retinitis pigmentosa. So far for the past 2.5 years, it has proven successful in that regard. So I'm very hopeful that will come to a positive outcome and obviously be commercially available. As far as assistive technology goes, I've still got pretty decent central vision. I've got 20/32 vision in one eye and 20/40 in the other. So there's no need for me to use screen magnifiers, but I do use the high contrast software setting on my Windows computer. I do a lot of computer work, so since I started using that about 10 years ago, it's helped immensely. Sure. And then I also use a cane as well. So.
Sure. Mark, you were mentioning with the investigational gene therapy that that product has halted the progression of your XLRP in, of course, one of your eyes. How have you noticed that in your life?
Well, that's a tricky question. They treated my left eye. My left eye is pretty bad. But there was a short period of time there where I could tell a noticeable improvement in my vision in my left eye. But that was very short, and it has since gone back to its baseline behavior. So I can't sit here and definitively tell you, yes, I can see better, or it's helping me, navigate better, or anything like that. I just have a lot of hope that it is working, and that, it will not progress any further. The flip side of this is it was my left eye that was treated. My right eye is it's untreated, and it is progressing. Yeah. And I can tell that as the years go by. Sure. So I hope and I pray that we can get both eyes treated very shortly.
Sure. No, that's really, kind of a very helpful insight into that. I guess, in terms of, comparing that progression, you said it's been 3 years since the start of that trial. Can you tell us what, for example, on your right eye, 3 years of progression has looked like?
Again, it's tough to explain, from a visual standpoint of what it's looked like, but I can tell you that I have lost the ability to recognize people's faces. I can very rarely make eye contact. And this has all been happening to me over the past 2 years or so. It's all very new and very fresh to me.
Right.
So in that regard, with my right eye being the better eye, I've relied on my right eye for a number of years now. And now I do believe that it is progressing and getting worse because just life in general has gotten more difficult as far as, navigating, working.
Yeah.
Again, I can't recognize people's faces. So that's probably about all I can tell you with regards to that.
Yeah, and that's super informative. It really, those kind of real life benchmarks are the kinds of things we want to hear about here. So, for you saying, losing the ability to recognize faces, that is really, really important. So thank you so much, Mark.
You're welcome.
Matthew, just kind of covering our bases here on things that have been helpful, useful, what stands out for you?
Hello, my name is Matthew Bacho. You can call me Matt. I currently live in Vancouver, Washington, which is close to Portland, Oregon. And I'm 52, and I was originally diagnosed when I was 13, and more specifically diagnosed with XLRP about 8 years ago. And I retired from work at the end of last year because of my vision. A lot similar to Mark. I'm currently enrolled in a gene therapy trial. This is my 4th clinical trial, actually, regarding my vision, because not only am I, interested in improving, if I can, my vision, but I'm also interested in advancing the science. My experience, much like Mark and John, I use simple things like lights and a cane, a magnifying glass. And my experience with the gene therapy has been interesting. My background is science, and so I understand it to a great extent, and I was really excited to be a part of that. I've had to decrease my expectations. At first, I thought that at least we could stop the progression in my treated eye, the left eye, but it appears after about three years that progression continues, and that's the major reason why I decided to retire from work. More specifically, the tests indicate that the sensitivity in the treated eye to light has improved, but it does not translate into my day-to-day activities. And the interesting thing, and now that I've lowered my expectations and I've got a chance to look at the physiology, the infrared photography, photographs of my retina, it appeared to me that perhaps it wasn't, getting thinner at the same rate as the untreated eye. And I haven't received any information about that. But right now, I think my realistic goal is to slow down progression at least. So.
Sure. No, that's very helpful. And, have you, from the other clinical trials that you were in, did you have other, similar noticeable impacts, even if, something akin to slowing or stopping progression for some period of time?
No, so the very first trial I was in through the National Eye Institute at NIH was vitamin A. And I must admit, my expectations were not very high, but I don't remember, any improvement at all. The other 2 trials, which were pretty small, through the Wilmer Eye Institute, Johns Hopkins, involved acupuncture and yoga. And my expectations for those were not also very high, but I was interested in those therapies, and I found them very intriguing. And indeed, yoga did improve my balance, so I was kind of happy about that. But no, I did not see any noticeable improvement in my vision.
Sure. Well, thank you so much, Matthew, and I'm sure we'll be exploring some of these other treatment approaches as we advance the dialogue more. Want to do another shout out, and if you'd like to share some of your treatment approaches, experiences with them, to call in at 1-703-844-3231. I also want to remind you, I think I didn't call this out before, that like in the morning, you can also write in with comments if you prefer. There is a comment feature. If you scroll down on the webpage under the live stream, there is a comment box where you can submit comments periodically, again, as we talk about different topics here in this afternoon session, and we'll be reading those periodically. But I'm going to come back to our Zoom panel here and round it out with Tim. Tim, would like your thoughts around, kind of this treatment successes, with treatments being defined very broadly as all kinds of different approaches that you might employ to make living with XLRP a little easier. What would you call out as maybe what's been most helpful?
Well, I've used a lot of different things like screen readers. I have a white cane and sunglasses and different things. But my greatest fear is that I'm 66 years old, and I'm afraid that the cure is not going to be found in my lifetime, and that I will go totally blind. I've worked up until I'm 66 years old, and up until 3 years ago, I've always worked ever since I've got out of high school. But it just seems like every time I go to the ophthalmologist, or I even went to the Wilmer Eye Institute at Johns Hopkins, and they just tell me that there's nothing they can do for me. And but like I said, all I'm going to say is you all have got to get on the ball, because I don't have this much time left. I'm losing eyesight at a tremendous level, and it's really, really worrying me. I even tried to qualify for a clinical trial, and they told me my eyesight was too bad.
Right.
But it's just that I've tried all these different devices that like to do things like help me watch television, and none of them work. It seems like everything is geared towards more macular degeneration rather than people with just a little bit of central vision,
right.
which is what I have. I've never had more than 9 degrees peripheral, and I've never had any night vision. But right. It's just my eyesight just keeps getting progressively worse, and it's just a tremendous worry, because when I go totally blind, I don't know what I'm going to do. I have to depend on my daughter to take me anywhere. Well, before, my wife used to, but she passed away 14 months ago, and I had to be her for pretty much the last 3 years.
Yeah.
And it was just very difficult. But all I'm going to say is that I've heard things like 6 years ago, I heard that within about 4 to 5 years, we would have CRISPR. And I haven't heard anything about that. And I wondered what happened to that.
Mm-hmm. Yeah.
So I just feel like I'm running out of time.
Yeah. Well, thank you for sharing that, Tim. And, I think, it's really important, everybody's at a different place, in their journey or progression with XLRP. And, I think, where you're at, you're telling us loud and clear that, the kinds of devices and accommodations that exist, aren't all that helpful, and they're certainly not, stopping the progression, and that's a real worry. So thank you so much for sharing that, Tim.
Yeah, especially, I live in the third world state of West Virginia, so I don't have as much access to some of the other, to do like a clinical trial or to go to a main hospital.
I'd have to have somebody drive me for like 6 hours or more.
Right. Yeah. No, and that, certainly is also a big barrier to care. And yeah, so thank you for sharing that as well. I see that we do have some comments before we transition. I think, Tim, you started pointing out some really good of what I'll call treatment kind of, failures or downsides, and we're going to get into that. But maybe just the last word on what has been useful. I know that there's been some comments. So Todd, do you want to touch on some of those?
Yeah, I'd like to. In fact, I'd like to select this particular one because Lisa from Sunnyvale, California, mentions a few things we haven't heard before today. She writes, I take higher levels of DHA, lutein, and zeaxanthin daily, general liquid vitamins, and eat mostly organic food, drinking a lot of filtered water. I get daily exercise, at least 7 hours of sleep. Otherwise, I can't see my best the next day. I wear prescription sunglasses, a visor, and protective shoes so I don't stub my toes. I keep my regular glasses handy in case the light levels dip down and I need them quickly, especially while driving. I know my day driving days are numbered. I use Lyft or Uber if I need to go somewhere at night with my minor daughters. One is adopted and blind due to LCA. The lights in our home are LED and everywhere. We modified the lighting when we moved in and put in a solar tube in the kitchen where I cook. We bought a one-level home with no steps intentionally.
Yeah, wow. So a lot of different approaches being trialed and errored and used kind of in conjunction, which I think we're hearing is kind of a recurring theme here as well. So I want to broaden the discussion. I know I wanted to try to focus on some of the things that have helped initially, but sometimes it's hard to know, and other times we might know for sure that something's not helping, at least in a way we might have had a hope or a goal for. We've heard a little bit already about what our expectations were kind of going into a treatment approach. So at this point I want to move into kind of assessing some of the downsides or negative treatment experiences, and we'll do that starting with a polling question. So go to that browser or browser tab that you have opened on your computer or on your phone. Go to pollev.com/XLRP, and we will, at this point, we want to ask you a question on what are the biggest drawbacks of your loved one's current approaches to managing XLRP. Select the top 3. So again, we're thinking about that totality of all of the different medical treatments, investigational treatments, medical devices, assisted devices, adaptations and accommodations. What are the biggest drawbacks across the board? Please select your top 3. The options are A, it's not very effective at treating target symptoms. B, it only treats some but not all of the symptoms. C, there's a high cost or copay or it's not covered by insurance. D, there's limited availability or accessibility to the treatment. E, there are side effects. F, the route of administration is a drawback. G, it requires too much effort or time commitment to do the treatment approach. H, some other drawback that isn't provided on this in these response options, but one that you would consider a top 3 drawback of current treatments. Or I, not applicable because you are not using any treatment approaches. So please select your top 3 of these different options for biggest drawbacks of current treatment approaches. All right, well, while any final responses are trickling in so far, looks like A, the fact that they're not very effective at treating the target symptom is the biggest drawback that's being reported. I would say number 2 would be limited availability or accessibility of the current treatment. So of course, a lot of these are going to depend on what treatment you're talking about and what the circumstances are, and so the context will be very important. So we'll ask that you please consider calling in and writing in with that information. So after number 2, we kind of drops down and we see that B, only treating some but not all of the symptoms, the route of administration of the product, the cost or copay or lack of coverage of insurance, and other things that weren't listed were all selected by some of our participants as being a top 3 biggest drawback. Nobody selected side effects or the amount of time or effort needed as biggest drawbacks of our current treatment approaches. And again, consistent with our past polling questions, we have a number of individuals who say that they are not using any treatment, so this is not an applicable question for them. So again, we asked you these polling questions to get you thinking about this and thinking about some of the drawbacks. Now we'd like to hear from you about those. Of course, if you want to continue to share things that have worked as well, we're still interested in hearing that. So I'd like to go to the phones and hear about some current treatment approaches. I see we have Dave from Illinois, who himself is affected, as well as having a number of affected family members. We'd like to speak to treatment approaches he and perhaps they have tried. So Dave, I'd like to welcome you to the program. Are you with us?
Yes, I am, and thank you for having me on.
Yeah, well, thank you and welcome.
You're welcome. Thank you. My name is Dave Jackson. I am in Springfield, Illinois, and 70 years old. I've had RP since I was born with it, of course, but learned about it when I was in grade school, and they told me by the time I was 35 or 40, I'd go totally blind. Actually, I've been blessed. I have had a career, through using different technologies, tape recorders when I was in college and such, but computers with the JAWS and a clear reader with the scans of the print, and the talking cell phone, which has been a big help.
Sure.
But one treatment I wanted to share with you is I worked 22 years with the Bureau of Blind Services. Rehabilitation instructor was my job, teaching people how to live independently within their own home with visual impairments, because I was one myself.
Yes.
Well, one of my former clients, a retired school teacher, called me one day and was telling me about something that she had found, and her vision. First of all, my vision, I have no central vision, but I do have peripheral vision, okay? And slowly deteriorating, slowly getting darker and darker. And she told me one day at a support group meeting that I was attending with her that it was getting worse. Anyway, she called me a couple months ago in December and found this stuff that someone had shared with her. And it's helped her vision improve a little bit and get a little brighter. And now she's able to even see central vision, see colors, which is surprising. And knowing she's a very reliable source, I myself thought I would just experiment. And so I started in January, and it worked so well that after 3 months, I thought I'm going to try it for 6 more months to see. It's a vitamin supplement called VisiClear, VISICLEAR. It's 10 different kinds of vision, kinds of vitamins, supposedly. The guy who developed it put in there. Andy Perth is his name. But anyway, I'm not here to sell it, but just to tell you this.
Yeah.
But anyway, I take 2 capsules in the morning before eating or anything. I've been doing it now for 4.5 months. And now my vision, I've noticed my peripheral vision, things are getting brighter. And I've been very active my whole life, and I go walking every day, a mile around the neighborhood. I've noticed that when I walk, depending where the light's at, above my head or behind me, helps me to even see better with the light-colored sidewalk. And, of course, I can't see the colors. I live in a black and white world, but I can see the grass. And that, boy, helps me to walk even better down the sidewalk and around using my white cane. And I just noticed that things are brightening up. And I'm very encouraged because I entered into this with I expect nothing, but if one little thing happens, but I'll be encouraged.
Yeah.
I did take the results to my retina specialist, Dr. Stone over at University of Iowa City, and also to my medical doctor to make sure that the ingredients were not damaging my body in some way. And
Sure.
in fact, my retina doctor, Dr. Stone, told me that he was very encouraged with what I was able to share with him.
Yeah, so just to clarify, Dave, so what you're describing is your range of vision didn't change. It was more of the brightness, or maybe a little bit of the clarity of, you know, some of the peripheral vision that you already had. You know, and that
Actually, excuse me, I'm sorry.
Yeah.
Actually, the left eye was my bad eye, it still is, but I've noticed that that is starting to get better. Even my central vision.
Okay.
Now, I can sit in my lazy boy, because my vision is really like a horseshoe in front of you, from one ear underneath the chin to the other ear. That's
Okay.
my peripheral that I see. I can look under the bottom of my peripheral, and my vision down there is pretty bright.
Okay.
I can actually see a television now. I couldn't see it before for a long time. But I can see the TV. I can see things moving, but I can't see clear enough to tell what it is. I'm still listening a lot to it, of course.
Mm-hmm.
But it has brightened it, and it has improved my clarity peripherally a lot, and that's very, very exciting to me at this point. But like I say, I'm just experimenting still for another 6 months just to verify.
Sure, sure. No, we really appreciate it, and you know, we're interested in hearing about all different kind of approaches. So, kind of this, you know, blend of. I was just going to say this kind of. Yeah. So this blend of, you know, kind of vitamins, you know, and supplements, you know, very interesting to hear how these changes you've experienced have even translated to improvements in the home, outside of the home. So thank you so much, Dave, for sharing. I'd like to, I see we have some phone calls coming in that also want to share some other treatment experiences. So would like to go to Lisa from California. She herself is affected and also a caregiver. Kind of, again, we are seeing a lot of that, of course, in this inherited condition. And she has a particular treatment approach she'd like to share her father's experience with. So Lisa, I'd like to welcome you to the program. Are you with us?
Yes, I am. Thank you so much. I was actually on the panel this morning. I'm calling in from Sunnyvale, California. My dad has the Argus 2 retinal implant.
Okay.
He got it back in 2007, and that was an amazing experience to go through that with him. Of course, it was approved by the FDA. He was able to get back some usable vision after not having any for 25 plus years. So we were really excited about that. The vision that he was able to get back allowed him to mobilize much easier, especially in terms of like crossing the street and staying in the white lines and knowing that he was in the crosswalk.
Yes.
As a caregiver, that gave me a great relief to know that he could navigate the world better, because he is a practicing lawyer, even still, at 81 years old, and he takes the bus all around the San Francisco Bay Area by himself. So it was just a great relief to know that, you know, he could see more high contrast. Like he could tell if I was wearing a white shirt or, you know, black bottoms. Mm-hmm. Just a little bit of usable vision after having none for so long was like a dream come true for us. Unfortunately, the company Second Sight that produced Argus 2 is no longer. Now, what that means for him is that he has the retinal implant still behind his left eye.
Yes.
It is not going to be removed. They've told him it'll go with him to his grave. And that's kind of a good thing, because going through the operation, it was a little scary, taking out the eyeball and getting it in back there and stapling in there and all of that.
Right.
And he did get a slight infection afterwards, but it cleared up after a few days, thank goodness.
Okay.
Unfortunately, now he doesn't have the what he needs device-wise for it to function because of the company going under. So he just has it in the back of his eye, but the computer system that works with it and the glasses, they're not all functioning together as a unit anymore. So he has lost that ability to navigate a little bit easier.
Sure. Well, Lisa, thank you for rejoining us this afternoon, but also we hadn't heard a personal experience about the Argus implant yet, and so It's great to hear that when it, at least when it was functional, that did lead to some real, regain of kind of functional vision, and allowed your father to navigate. And we heard a lot about transportation impacts in the morning, and so being able to participate in transportation rather, really important. So thank you for sharing that. So I'd like to go to one more phone caller here. We're just trying to hear about these, a range of different treatment experiences. And so we have Susan from New Jersey, who herself is affected, as well as her sisters, to share some of her treatment experiences. So Susan, I would like to welcome you to the program. Are you with us?
Hi, thank you.
Yeah, so please share. I know that you had mentioned you wanted to talk about a couple different treatment approaches.
Yes. Well, I'm 60 years old, and before I had kids, I did try the vitamin A, Palmitate. I don't really know how well it worked, but I didn't really like the idea of having to have my liver tested every 3 months, so once I got to my childbearing years, I stopped taking that. The RP, unfortunately, I ended up getting cataracts, which is common, and then when I had my cataract surgery, I ended up with glaucoma, which was one of the side effects that can happen. So I had a lot of complications, and I actually am due to have cataract surgery in 2 weeks. In the meantime, because I just really, my family's again, someone else shared earlier, when you have other family members that have it, it's kind of like an internal support group, so that was great. So we try to stay positive. I bought an indoor bike because I couldn't bike anymore. I did go get a seeing eye dog, which I thought is invaluable. I can walk 4 miles on my own if I want. I did get COVID about 1.5 years ago, and it's funny, everyone talked about, the anxiety and depression. I was never a depressed person, and I guess I was always you're innately stressed when you have an eye condition like this, but it never came to the surface. After I got COVID, I really have been anxious a lot lately, like afraid to go out walking alone and certain things. But I'm battling that, and because of that, I've been taking a lot of supplements, ironically, and doing all these other kooky things. I shouldn't call them kooky, but so I was taking this Nordic brand fish oil, and I also started doing this tapping thing. It touches the pressure points, and I have to say, I feel I don't have as bad a vision days. Like, I do feel like my vision is clearer, which I know sounds really crazy, but it's working, and I do feel that our vision can be tied to how we feel, and I think when we are stressed, it compounds not being able to see well.
Sure. So Susan, this is really interesting. We heard a lot this morning about exactly that, the relationship between vision and fatigue, vision and stress and anxiety. So do you, kind of in your own personal opinion, do you think, some of these approaches that you've more recently tried have, that's been helping with your stress, and that kind of then downstream from that has been helping with your vision, or do you think it's been the other way around?
See, that's what I don't know. Like, it's like, how do we know? And of course, if I bring it up to the eye doctor, they think I'm crazy. Like, if I say, like, I feel like my eye pressure from the glaucoma goes up when my blood pressure's up, they're like, nah, it's not related. Like, so it's hard to tell. But all I know is whatever it is that I'm doing that's maybe making my anxiety better, my vision is just so much more clear. Like, I used to not be able to make out the TV at all. And, like, if there's big numbers on the TV, like, say, the Jeopardy board, I can see those numbers now, which, like, I really wasn't seeing them at all. I am getting the cataract surgery in 2 weeks, which I'm very anxious about, but I'm optimistic that maybe that'll even make it even more clear.
Sure. Yeah, well, Susan, thank you so much for sharing this. Very interesting, and glad to hear about some of those improvements that you've experienced. I see that we've had a number of comments come in on the topic of some treatment downsides. Todd, would you be willing to share some of those?
Sure would. Yeah, I'll mention this one. Paul writes in from Colorado, and he says, no matter how I adjust and adapt and train, whether it's cane training or OT at a blind rehab center or prescription drugs for anxiety or training to use computers and smartphones, the bottom line is that I'm still blind. So that really points to the limitations of what's available. I also wanted to call out too, Laura writes in from Lancaster, Pennsylvania. She says, I'm a female with the RP-GR version of RP. And although I was told I was a carrier, I started losing night vision in my teens and have been legally blind since my late 40s. My niece, whose dad has RP, is following my pattern. Yet we are not considered eligible for the gene therapy trials due to our sex, which is maddening. So that speaks to the limitations for what's available in the investigational route at the moment.
Yeah, and we saw in some of the polling, some of the downsides being about accessibility or access. So that may be actually a reflection there of that. So thank you for those who have been writing in and calling in. Again, if you'd like to join the conversation, you can call in at 1-703-844-3231, or you can continue to write in using that comment feature under the live stream. But I'm going to come here and bring our Zoom panel into this discussion of treatment downsides. You know, Matt, maybe we'll start with you here. You know, I know I probed a little bit and asked about some of your past clinical trials, and I know that some of those maybe weren't as successful. But as you're thinking more broadly about treatment downsides, maybe answering that polling question, what stands out to you as a major downside that you'd like to share?
Well, from my personal experience, and I think a lot of folks online will understand this, is anytime you have to go through a clinical trial, there are a lot of tests, right? And I've gotten used to them over the years. And the good thing is nowadays it's one study visit a year, so that kind of helps. But those tests can be sometimes a little frustrating, but I've gotten used to them, and the technology's gotten better. It seems like back in the old days, well, 90s, I wasn't sure that the folks were getting a lot of data, but I think the technology has really improved, and I think that makes it worthwhile and helps me as a participant know that they're getting some good data. Surgery, as everyone knows, always involves some risk, and so if you're anxious naturally, that can be a major barrier too, even if it's just cataract surgery. That actually, honestly, the gene therapy I underwent was just fine because they put me completely under, but I know with cataract surgery, they don't do that. And that was quite uncomfortable. So, being somewhat, you're always afraid that you'll move, right? And they're asking you questions. And so that was kind of nerve-wracking when I did that back in the 90s. In my personal experience with this latest gene therapy, the route of administration became problematic. In my case, it was a subretinal, and they asked me ahead of time if they could treat the fovea, which was really probably only part of the retina that I was using, and I agreed because I wasn't sure that I would get a lot of benefit if it was not directly, if it wasn't directly injected close to the part of the retina that I use. Yeah. And unfortunately, it led to some. It led to a problem with acuity. It's decreased a little bit, and the images I get through my left eye are a little shifted, and the distortion I have was a little frustrating, and I've kind of gotten used to it, and I think my brain has been able to compensate to some extent where I rely on the vision from my untreated eye so that my images aren't so distorted. I see that they're working on intravitreal administration. I'm wondering if perhaps that would avoid such problems, but those are kind of some of the downsides, that I've experienced over the years.
Yeah, very interesting, Matt, because you've named a number of different downsides from, kind of a battery of tests that they put you through in a clinical trial to the discomfort of being awake during cataract with the gene therapy administration. But it sounds like, and correct me if I'm wrong, these are all things that for you, they're kind of risks you're willing to tolerate, for, a potentially efficacious treatment. But maybe you can speak to that a little bit.
Yeah, and it's honestly, I would just say I'm lucky. When I go into surgery, I don't I don't feel that anxiety that some people would, different people would feel. I've just been lucky that I can get through that. And because of my experience, I've been doing clinical trials since the 90s, not just in vision, but in other areas as well. I've kind of accepted those normal risks. And it's just a personal thing. Unfortunately, I'm not sure how I could assure others, because every situation is different, right? And everyone has a different surgeon, and there are just so many factors. But I think it's just luck, really, that I can tolerate some of these stressors, and others have to do a much more careful analysis of benefit and risk, right? How much can I expect a market improvement, even in cataract surgery? Will it be worth the risk? Even though the risk, I think these days, are pretty minimal for most people. But I think everyone has to decide on their own, the risk benefit, and whether or not they want to, especially when it comes to surgery. That's how I'd summarize it.
Sure. Thank you so much, Matt. John, if I can bring you into this conversation about treatment downsides, either things that you tried that haven't worked, or things that you've tried and maybe whether or not they've worked, they've had some trade-off or negative aspect. Anything you'd like to share on this topic?
Well, I'm going back to what Lisa just mentioned, these good days and bad days, and trying to ascribe cause and effect to those days. So many years later, I'm still trying to figure out why I'm having a bad day visually and when I'm having a good day. So trying to put all those pieces together to figure that out. And, that's where we, hopefully look to science to help understand that, as opposed to, anecdotal type references. So.
Yeah, so interesting there is kind of in decisions to seek out or decide to use treatments, there's not as much information as you would like on, is it just the effectiveness of the drug, the risk profile, or both?
Well, it's not so much as opposed to, if there's a particular treatment available, but just what people are suggesting, and I know Tim referenced earlier, how there's nothing available for him, right? And I know there's a lot going on in terms of gene therapy. Currently down here in Minnesota at the Mayo Clinic, there's a study kicking off around that. But yes, you do have to have enough vision to save, right? To make that meaningful. And so for a lot of us at this end stage RP, we're hanging our hats on stem cells, right? To really be able to regenerate those cells, those rods and cones.
I see. Well, thank you, John. Mark, want to give you the opportunity as well. Any negative treatment experiences or downsides that stand out to you, something you'd like to comment on?
I've got no real I've tried various things throughout the years. I still to this day take vitamin A with palmitate, and I also take DHA, several other vitamins.
Sure.
I've done acupuncture in the past. I feel like acupuncture is helpful. It helped brighten up my vision. I actually started doing it again recently. This clinical trial that I'm in now with the gene therapy,
yes,
there's a lot of hope and a lot of it's just, I'm very optimistic about it working. However, the biggest drawback with it, I'm absolutely fortunate and grateful and blessed that I got the opportunity to participate in this trial. It's a 5-year trial. I'm going on year 3 now with just my left eye. But what's so frustrating about it is I can't get my right eye treated. So as my left eye, as the researchers are telling me, it has remained stable. My right eye just keeps on trucking. just keeps on getting worse.
Right.
And it's very frustrating, agonizing almost, that I can't do anything about it. I can't get my right eye treated as well.
Right.
But all in all, I'm just very optimistic about the gene therapy, and I'm proud and happy to be participating in it, to advance the science. I just wish that there was, I wish we could break down the barrier and just, let's go ahead. I'm ready to lay down on the table and get my right eye treated. I'm ready to go, because the older I get, the worse my vision gets.
Right. Yeah. Well, thank you, Mark. I really appreciate your perspective, and it's kind of another take on kind of accessibility as a big barrier and downside, given especially your personal experience with treatment in your other eye. Before we move to one more topic, I want to check in with Todd. I know a few more comments have come in on some treatment downsides. So what are we seeing?
Yeah, I'll read out this comment from Paige in South Carolina. And this is about some of the other treatment approaches, not gene therapy. She writes, what are the significant downsides? My fiance gets fatigued quickly. He works on a computer for 10 to 11 hours during the week. On really tough days, his right eye seems more affected. His left eye is stronger. The stress of work and trying to always prove himself for 10 to 11 hours during the week. On really tough days, his right eye seems more affected. The stress of work and trying to always prove himself really greatly affects his mental state and anxiety, and he is very worried about not being able to see his computer one day.
Wow.
And then Mike from London, welcome Mike, writes in, I had gene therapy in one eye in 2017, but since then the treated eye has deteriorated at the same rate as the untreated eye. The treated eye also took a one-off hit from the invasive nature of the surgery itself. And however, I only got a low dose, and I am confident that once optimal doses have been found, gene therapy will be effective, especially for younger patients. At 46 at the time, I was probably too old to benefit from gene therapy. For a massive boost in night vision, I am using augmented reality smart glasses. Other patients should test out various VR or AR glasses.
Great. Thank you for those of you who have been writing in, calling in. We're going to expand our discussion to the final topic of the day. Now that we've explored a number of the treatment approaches that you have available, we've heard about things that have helped, things that maybe we're uncertain around if they've helped, and some that just haven't. We've heard about some of the trade-offs and downsides, many of which you all have expressed a willingness to tolerate in exchange for the opportunity to benefit from products. But now we want to look towards the future, and given what we have, and for what it's worth, how well it's working, and the gaps in terms of the unmet needs that you have that exist, we want your thoughts and your views on what you would want to see from future treatments. And so, like with each of our other topics, we're going to start off first with a polling question, which will be our final polling question of the day. So this is your last chance to go to that browser tab that you have, go to pollev.com/XLRP, and give us your thoughts on which aspects of your condition you would rank as most important for a possible new drug today, and select 3. And you'll notice, and we made this hard, we purposefully did not put a cure on this list. I think that is something that universally we all want. But the way we want you to think about these questions about future treatments is short of that cure, before we get to a cure for XLRP, what is it that you would prioritize? What is it that would make the greatest impact in your daily lives? And we want to hear, what you're thinking and why you're thinking, how some of these changes could translate to important improvements, and what amount of improvement do you need to see? We've heard already a little bit today about where some small improvements with some of the existing treatments translated to big benefits, where there's been goals for slowing or stopping of progression. But we've also heard where there's a need for real larger improvements. And so this is a very personal question, and we want to hear your very personal take on this. And so The options here you can select your top 3 aspects that you rank as most important. Their options are A, improving visual acuity, B, being able to walk or ambulate without assistance, C, using your computer, D, helping with night vision, E, helping with peripheral vision, F, travel and vacationing, G, participating in social engagements and events, H, participating in sports and other recreational activities, I, attending school or having a job, or J, some other aspect of living with XLRP that you would rank as most important for a possible new drug treatment today. So I know these questions have gotten probably progressively harder to answer and pick just a limited number of options. But we really want you to think about this and think about the why of your selections. As it stands, A, improving visual acuity appears to be the top response option, followed fairly closely by helping with night vision and help with peripheral vision. We also, the results also are showing us that walking and ambulating without assistance and being able to attend school and have a job are important. Some of those might be multifactorial, which is why they're being ranked high, in addition to some of the more specific aspects of vision. But we want to hear if that's actually the case. I don't want to make an assumption about your selections there. We also see participating in social engagements and events, participating in sports and other recreational activities, and using the computer as areas that you would like to see for a possible new drug treatment to help with in several people's top 3. We only see travel and vacationing show up as not being in people's top 3, as well as no one selected other. So we want to explore these. We want to hear what you were thinking, what you picked, and why. And so to get us started here, we're going to come back to our Zoom panel, and I'd like to start with you, Tim. As you were, we're listening and thinking about those, different aspects of living with XLRP, what to you, is your priority for a future treatment to be able to help with or address in some way?
Just more acuity. Just be able to clear up my vision to where I can at least see just a little bit better.
Yeah.
I've lived with the loss of peripheral vision for so long that I'm used to that, but I think more acuity is what I really need.
Yeah, and could you maybe in some practical terms, help us understand what would a little bit more visual acuity mean for you in terms of what you can do in daily life? What are you looking for out of that?
Just be able to see, to do things where I don't have to have help with everything.
Mm-hmm.
Just be able to do some things.
Sure. Yeah, a little bit more independence.
Yeah.
Sure. Well, thank you so much, Tim. Everything you've shared has been so important and helpful. John, let's go to you. As you're looking at that list or thinking more broadly, short of that cure for XLRP, what would you look for from a future treatment?
Yeah, I think, like Tim, I think as you progress down the path of RP, where central vision begins to get more impacted, looking for, gosh, I just wish I had better central vision at this point so that was my topic as well, is just to get better central vision and be able to better see you guys on the screen and read.
Yeah. And how much improvement would you need to make it so some of these things would be easier, or what, maybe in more practical terms, is there something that you can kind of pinpoint as like what would be a personal milestone for you that would be important?
2020, how about that?
You snuck in a way to say cure without using the words. No, that's very helpful. Thank you, John. Mark, how about you? What do you view for you as what you would now look for from a next, future treatment?
Well, the option for all of the above was not available, but I would say all of the above, most certainly.
Yep.
But to be a little bit more specific, what I've had the toughest time dealing with, especially over the past 2 or 3 years, is I'm losing my sense of independence. Literally, if I'm out in a public setting, I can't go to the bathroom on my own. I can't, walk to the car and get something out of the car on my own. Because it's very dangerous. When you're visually impaired, if you take the wrong step, you could fall, you could break a bone. There's all, and I've literally gotten to the point now to where I rely heavily on having a shoulder or an elbow to hang on to when I'm in public. So if I could truly pick one of those options, it would be that. And of course, along with gaining independence is overall improvement in the cure. So that's kind of what that leads to. So but no, I think all of those topics are incredibly important and valuable.
Yeah. No, and I appreciate it. It was really an impossible polling question that we gave you all, but do appreciate that commentary on kind of walking, but really navigating, I guess, is probably the better way to say it. Around our life a little bit more. Is there any kind of specific way to describe from where you are now to what it is that would be different in terms of what you could do when you were describing, kind of being able to safely navigate, that kind of would tell me or a listener, where you are now and where you would need to be for that to be a useful improvement for you?
I would just, I would need to get more functioning vision back. It's very humiliating, in certain situations that I can't do things on my own. And this is relatively new to me because I've been dealing with RP for multiple years, but it's really kicking in high gear here over the past couple of years or so since I've gotten into my mid and my late 40s. So I'm still adapting. I'm still trying to learn this thing, how to just kind of swallow my pride and rely on people to help get me around. Gosh, if I could get my sense of independence back, I used to be incredibly active and, tennis, driving, skateboarding, you name it. I used to do a lot of it and thoroughly enjoyed it. And these are things that just disappear as retinitis pigmentosa, does its job on you. So anyhow.
Sure. No, thank you for expanding on that, Mark.
You had an earlier panelist who, described it as surprises, right? And every day is a surprise, and we have to adapt to just this changing vision that is always with us. So every day is an adventure and surprise. I really liked how he put that.
Sure. Yeah. All right, and Matt, to give you the final word of at least of our Zoom panel here today, what would you like to leave us with in terms of what you're looking for, short of that cure, from a next future treatment?
Well, I definitely agree with the others. Instead of picking, acuity or night vision or peripheral vision, which we would all like to see an improvement in, I actually selected kind of 3 goals. Obviously, once you've kind of achieved some of that improvement, one would be, just mobility in general, being able to get around, as Mark mentioned, being independent, not having to rely on others. Social interactions, I've learned, my vision has been fairly impaired as far back as I can remember. And I know that with folks who have had good vision and then have had to deal with a declining or rapidly declining vision is something else entirely. So my experience has been different. And so I've learned over the years about the importance of, nonverbal communication. So social interactions, being able to make eye contact, seeing a smile or a wave and not having to explain why you didn't wave back. I mean, I think those are things from my personal experience would be a great thing to get back or to improve. And of course, based on my experience in trying to get a job and starting a career when I was younger, just getting your foot in the door and getting into school or whatever, I think being able to contribute, in society, those are all the goals I think that we all would want to achieve and to improve on. So I decided I'd select those instead of just the norm, the characteristics which we would all love to see improved.
No, and that's very helpful, and those are important, real life kind of benchmarks. And so I appreciate you sharing those, Matt. Just want to thank our whole Zoom panel here for all of your contributions. We're gonna to let you all go, but we're gonna still continue this conversation. I know the written comments have been coming in on this topic, and so I want to turn to Todd and have him explore some of those with us.
Sure, we've got a number of comments that have been submitted about this question about what your expectations, your treatment goals for future treatments. One person submitted the following answer. He said, "This is an easy answer for me. In order of my preferred priority: 1, vision restored; 2, vision enhanced; 3, vision stabilized, and in all cases without a big risk to health and adverse side effects." Nancy writes in from Illinois. She says that my sons, 16 and 20, both are affected with XLRP. Their limited peripheral and night vision affects all the other choices in this poll, and we are hopeful that both will qualify and participate in clinical trials in the next few years. And then Paige writes in to say about potential downsides. My fiance has expressed concern for trying a new treatment that would possibly make his current vision worse. Side effects would be a major factor in his decision to try a new treatment. And the last comment here comes in from Jeff. He's giving some feedback about clinical trials. We're really hoping that the two companies conducting phase 2-3 trials will consider enrolling their qualified phase 1-2 patients in a crossover cohort so those patients can have their other eye treated, similar to what Spark did with their RPE65 Luxturna treatment. Or alternatively, establish a compassionate use program for those phase 1-2 patients to give them the opportunity to have their untreated eye treated. These phase 1-2 patients took on a lot of risk and spent huge amounts of time and endured big disruptions to their lives to advance these treatments to the next stage and should be offered the opportunity to have their other eye treated as soon as possible.
Yeah. Well, thank you to everyone for all of these written comments as well. I think we've heard so much today about the tremendous need that exists and how existing treatments that exist aren't stopping or slowing the progression of the disease, much less improving it, at least for long. We did hear some about some of those smaller or temporary improvements, but even then how those have had great translations to improvements in everyday life. So it's great to hear that even if something can help a little, that might translate to helping a lot. But this concludes the part of the day where we're hearing from all of you, individuals living with XLRP, family members, other loved ones and caregivers. You all have just been absolutely tremendous today. First in the morning, really pulling back the curtain to help us understand what it is that people with XLRP live with day in and day out. The range of visual impairment and how that changes, time and time again. You described it as fatiguing, both on a daily level, but as someone that's listened to you throughout the day, I can't help but just truly appreciate how difficult it must be and exhausting overall to constantly have those progressions, need to constantly accommodate, adjust, and adapt. And that came through loud and clear to me this afternoon as you talked about treatments. It was just reiterating the progressive losses that you first really described in the morning. XLRP is so much more than just vision loss, and I know sometimes it's hard to talk about some of those other aspects like the anxiety, the depression, the social isolation and issues. And so, you all were just so tremendous and brave today. And as your moderator for the meeting, just a heartfelt thank you to each and every one of you who, were one of our panelists, that were on Zoom, called in, or wrote in. Just one final heartfelt thank you from me, as I now will pass this meeting off to Larry Bauer, who is going to be providing our summary remarks for today's program. While moderating the meeting is a big task, the impossible task is trying to summarize everything that we heard in 10 minutes, but Larry is the perfect person to do that. Larry is a colleague and a friend of mine. He spent 14 years at the NIH, where he was a clinical research nurse. He then went to the FDA to co-found the Rare Diseases Program within the Center for Drugs, where he worked for 10 years. And now he's been a critical member of this EL-PFDD planning team. So without further ado, I'll pass us off to Larry to try to summarize today. Thank you.
Yeah, thanks so much, James and Todd. It's been a great day today. I will try to summarize at a very high level some of the things we heard today. I apologize in advance if there was a comment or something someone said that I don't get to in my summary. But please know that there will be a more detailed summary in the Voice of the Patient report that will be written at the conclusion of this meeting. So today our meeting was opened by Dr. Todd Durham, who's the Senior Vice President of Clinical and Outcomes Research at the Foundation Fighting Blindness. Todd's opening was followed with a presentation from Dr. Ekaterini Silu from the FDA's Office of Tissues and Advanced Therapies in the Center for Biologics Evaluation and Research. Dr. Silu shared with us how much patient-focused drug development meetings are valuable to the FDA, that the FDA staff, they learn from the experts, the people living with XLRP and their caregivers, and this helps facilitate treatment development for XLRP. Dr. Silu's presentation was followed by a clinical overview of XLRP by Dr. Tiran Jayasundara, who's from the Kellogg Eye Center in the University of Michigan. He talked to us that XLRP is basically driven by two specific genes. One is RPGR, the other one RP2. This genetic issue causes a loss of receptor cells in the retina that leads to retinal degeneration and atrophy. It's a progressive disease with 4 different stages, and it's a rare disease with about 15,000 people in the United States living with it. It's X-linked, so it's passed on in sex chromosomes, but both men and women can develop symptoms from it. It's important to identify the underlying causative gene to help direct therapeutic interventions. And he also talked about clinical trials and the importance of assessing patient-reported outcomes during clinical trials. So after this presentation, we moved to topic 1, which was focused on the health effects and daily impacts of XLRP. We heard from several panelists. The first was Jonathan, who shared with us that he was diagnosed at age 13 with XLRP. The first thing he noticed was trouble seeing in the dark. He said it's been devastating and changed his medical career to psychiatry, where acute eyesight was less needed. He considers IVF for future pregnancies with his wife. He talked about the challenges from not being able to drive at night and the reliance on taxis. He's very concerned looking forward about that he might lose his independence. And he said, "My vision is a ticking time bomb." We then heard from Will, who works on computer software. He was diagnosed at age 6 and used to bump into things. The most challenging symptom that Will has is that he doesn't know what's coming next. What will XLRP take away next from his life? He said it's embarrassing in crowds, and this affects his confidence. Loss of driving, once again, was devastating. And he said that XLRP strips you of the image you had of yourself. We then heard from Joaquin, who's 41 and first noticed symptoms at age 4. He talked about the challenges and difficulties he had both in elementary school, but especially during college. He needs a walking cane so that he doesn't hurt himself when he's out. And he also mentioned he can no longer drive, and he couldn't do many jobs, but eventually did find a job that suited him. He feels badly that his children can't count on him. Joaquin said, XLRP is killing me on the inside. And finally, in the morning, we heard from Greg, who has both a son, a wife, and a brother-in-law that have XLRP. He worries about his son's progressive vision loss and how it will impact his future development. He talked about how his son really can't play sports that involve a ball, and it was really not safe for him to do those sports. Unfamiliar environments are challenging for his wife. And the worst part, he said, is that XLRP takes away what you've already had. It's a continuous cycle of further loss and then needing to adapt and then further loss. So in conclusion from the morning, some of the themes were the people identified the many problems related to progressive vision loss, including decreased night vision and peripheral vision, aversion to bright light, and issues with anxiety and depression related to the vision loss. Significant life impacts were driving, participating in social activities, sports, and maintaining jobs. And most everyone repeated and reported that dealing with XLRP is constant and a daily battle. We shifted gears a little bit in the afternoon. Panel 2 focused on perspectives on XLRP treatments. Once again, we heard from 4 panelists. The first panelist, it was an intriguing story. We heard about Richard, and his story was told by his guide dog, Loot. He said having Loot is a significant aid to Richard in navigating unknown situations like airports. Richard's tried stem cell therapy, but without success. He uses an iPhone adapter that communicates with him. He's willing to tolerate some risk in a new treatment or a clinical trial. Then we heard from Paul, who was diagnosed at age 13. He's used a screen that enlarges text, but as his vision got worse, that didn't really help. He wears glasses, but not for sight, but to protect his eyes. He uses a text-to-speech app, but with limitations. And Paul's learned Braille as an adult, but he says he reads slowly. And in conclusion, Paul mentioned that technology is not a good substitute for having central vision, and preserving vision would be great for him. Then we heard from Bob, who joined the National Federation for the Blind. He takes a daily regimen of vitamins and minerals, including vitamin A. He and his wife chose to adopt children to prevent transmission of XLRP. And he is on disability, and he takes medication to treat the anxiety and depression from vision loss. Daryl, we heard from lastly, is very interested in assistive technologies. He's had XLRP since age 14, and he made the distinction between blindness and visual impairment. Visual impairment is something that happens over time, but people still rely on their vision to some extent. He uses sighted guides that help him in activities. And he said stopping sight loss progression would mean the world to him. He described the courage it takes to start using a white cane and the shift in identity that goes along with that. And he has participated in clinical trials. So overall, we heard consistently, there continues to be a great unmet need for people living with XLRP. A lot of the people said their current treatment regimen is only somewhat helpful at the best. A lot of the treatments out there are experimental. People overall would be willing to participate in research. Many have already done that, and everyone would like to see more effective treatments. Improving vision would be an ideal outcome, but halting progression would be meaningful, as would anything that can maintain or improve independence in life. So thank you. And at this point, I'd like to turn the meeting back to Todd Durham in the studio. Todd's from the Foundation for Fighting Blindness. Thank you very much.
Thank you for the summary, Larry. This has been a full day of hearing personal insights to help us all better understand XLRP and its impacts. Thank you to the FDA for giving us permission to hold this meeting, and to the staff who tuned in today, and to Will Llewellyn from the FDA's patient-focused drug development staff who guided us through this process. Thank you to Dr. Ekaterini Silu from the FDA for your perspective on the patient-focused drug development meetings, and to Dr. Tharan Jayasundara from the University of Michigan for the very interesting clinical overview of XLRP. Thank you to the Dudley Digital Works media team for all of their work helping with this meeting, and to James Valentine and Larry Bauer from Hyman, Phelps, and McNamara. A special thanks to the Foundation Fighting Blindness team, including Chris Adams, Janet Cheatham, Joan Fisher, Rebecca Ratchford, Cindy Smith, all of whom worked hard to plan this meeting and make it a success. Thank you to our supporters and partner organizations. This meeting would not have happened without your help. But a huge thanks goes to you, people with XLRP and their caregivers who shared your experiences, and to those of you who called in or wrote in giving your insights. This meeting couldn't achieve the goals if it weren't for you. It takes great courage to share your experience with us. Thank you. We'll compile all the information into a Voice of the Patient report, which will be available on the Foundation Fighting Blindness website, along with a recording and transcript of the full meeting. The web link to submit comments for the report is open for another 30 days, so please consider submitting additional comments, and they'll be added to the Voice of the Patient report. The video will be available on demand immediately using the same link. The report, along with a list of supporters and partner organizations, will be publicly available to anyone once it's published and posted to our website, fightingblindness.org. There will also be a link from the FDA website. Thank you to everyone. The impact of this meeting will be felt for years to come.